Today on Dr. Phil.
My daughter was kidnapped by sex traffickers.
Lured to a hotel room by an online friend.
I woke up in a black closet. They made me sleep with over 20 men a day.
Her mother speaks out.
She's not the only victim. But you think that I'm a little bit worried about me?
And what she says...
You sound resentful towards her.
...may surprise you.
If your child goes missing and you haven't seen them in 2 or 3 weeks, you're not a victim?
Let's do it.
Have a good show, everybody. Here we go.
This is a safe place to talk about hard things.
Stand by, Dr. Phil.
I'll try to be an emotional compass and point you in the right direction.
In 5, 4.
I am not giving up on you.
Go, Dr. Phil.
How you doing? How are you? Hey, guys. Okay. All right. Raise a hand if you have ever said something you later regretted. Yeah, raise a hand if you've ever posted anything hurtful about someone else online. Yeah, we've all said things we don't really mean in the heat of a fight, right? Sometimes you can just say sorry, but when it comes to social media posts, you can't always hit delete. If you have a teenager, pay close attention to what happened to my guest today. Desiree says she'll never forget the day she got into a screaming match with her teenage daughter. After that fight, her daughter vented on social media. What happened next is a parent's worst nightmare.
When my daughter Hope was young, she was a straight A student.
I was a normal, regular kid. I loved to do theater. I loved soccer and cheerleading.
Hope was filled with innocence, joy, and ambition.
When I was 14, my whole life changed.
My daughter Hope was kidnapped by sex traffickers. Hope was forced into prostitution.
It all started because I posted on a social media site that I hated my mother. A woman messaged me back telling me that I could go stay with her and we'd go partying. She showed up within the next 45 minutes and I was gone.
The suspects target girls who post comments about a negative home life on social media sites and chat rooms.
The 14-year-old, oh, I hate my mom. She doesn't understand me. I can't wait to get out of here.
That's how police say William Jacobs and Shayla Williams met a young North Texas victim who was just 14 years old.
I walked into the motel room. I see a man sitting in the corner. The first thing that came out of his mouth was, "Take off your clothes so we can take these pictures." And I'm like, no, I'm not gonna take my clothes off. He said, "So you wanna do this the hard way?" He hit me a couple times and after that I was out like a light. I woke up in the closet. The closet that I was in was about the size of me right here. After they took me out the closet, they took crushed up pills and they forced them down my throat. After they force fed me pills, I would try to move my body, but I couldn't pick myself up. They made me feel catatonic. After they drugged me, I had my first client.
Hope says she knew if she wanted to make it, she had to find a way to cope.
In order to survive my kidnapping, I had to create an alter ego. They told me that my name wasn't Hope anymore, it was Sophia. So that's the name that I took on. Sophia is the girl that walks with her head high. She was the one who dealt with all the clients and the Johns and the beatings. When I was with the traffickers, they never fed me. My source of food would be picking it out of the trash, drinking the water from the faucet. I bit my nails a lot. One time I was taking a shower and he busted it open and beat me with the belt because I locked the door.
The couple is accused of trafficking the teen in 8 different states in only a 3-week period.
The traffickers made me sleep with men in each state. Over 20 men a day. I could never be Hope again after that. I was never going to be the same girl.
Hope's mother says her daughter's terrifying ordeal claimed more than one victim. She says at times she feels just as traumatized as her daughter. She also says before today, Hope has never wanted to share her story or any specific details about what happened.
Hope's not the only victim. I'm a victim. During the time that Hope was gone, I felt lost. It took a lot of strain on my job, my relationship with my other kids. It was an emotional roller coaster. I tried to make up for things financially for Hope to compensate for what she had gone through when I really couldn't even afford it. Like, she called me, she's like, Mom, I need to come up there. And I'm like, are you coming to school? Are you gonna finish your school? Because you know that's the only reason why I will let you back in, but you're not willing to do that. So then you call me and you tell me, you're hungry, you need money. If I had it like that, maybe. But when I'm 60 years old, is she gonna still come to me and say, I need $200? What's gonna happen when something happens to me and I don't have the financial means to take care of me? Don't we all have to work for our retirement? Don't we all have to save for our future? And if I'm constantly giving it out, don't you think that I'm a little bit depressed? Don't you think I'm a little bit discouraged? Don't you think that I'm a little bit worried about me? Is that selfish? I love Hope. I love her. But she's not the only victim.
Hope, I'm glad you're here. Desiree, I'm glad you're here. You seem to be very traumatized by what happened to your daughter. Yeah. Tell me about that.
I didn't know the things that she shared with you. Traumatized in the manner that it was difficult. Throughout the whole proceedings, you know, it was about helping her and wanting to do the right thing. But every time anybody reached out to her to help her when she was returned, if it was not under the circumstances that she felt that was deemed appropriate or that she wanted, she would resist. So it became a struggle to help. And then it came to the point where, how much more can I do? What can I do? Do I give up my life dedicated to cater and to fix what was broken? I had 2 other kids, you know, and I was struggling, period. And I felt like the other 2 were being neglected, and I felt bad. I felt guilty.
I'm glad you're here, and I'm glad you're safe.
Thank you.
I can't even imagine what that had to be like at the time and what you went through. You went from posting a snippy message on a site to within an hour you were out of your house and gone, right? When you wound up in that motel room getting hit, was there a point when you believed you were never going to get out alive?
I'm pretty sure I thought that was the end, especially when I woke up that morning in a black closet, not being able to see. I thought I was dead.
Yeah. Up next, I have some questions for Desiree.
Hope was no longer hope. It was very difficult and was very trying, and I understand that she's not the same child that I had at one time, and she may never be that child that I had.
Are you resentful towards her? And later, you say you're a victim too.
If your child goes missing and you haven't seen them in 2 or 3 weeks, and then the grandmother gets a phone call saying, they're beating me, you're not a victim?
And you said as days went by and you got drugged more and more and days turned into weeks, at that point you actually started to adopt an alter ego to kind of, it's what we call in psychology, disassociate from it and just become another person, just become disassociated from it and become another person to get through it. Tell me about that.
Well, I have an alter ego. Her name is Sophia. She helps me cope with the situation. All of the bad things that I've ever gone through in life, definitely a lot of the sexual abuse that I've encountered, it goes onto her, you know, and all of that stuff, it makes her a stronger person. But me, if Hope was to be herself, she probably wouldn't be standing in here, wouldn't be on this show right now.
So you're saying the girl that started out in life, you're saying you don't think could survive this, so this alter ego was generated to be tougher, to be...
There's two different sides of my personality. There's Hope, the one who has social anxiety, who'd rather be locked up in the room all day and not come out, doesn't want to see anybody, doesn't want to talk to anybody. You know, she wants to be alone, just her. She'll go into her closet and sit there because that's what she knows. And then there's Sophia, who can go out and be around people, smile and laugh and do all the things that a normal person would do, but better.
And this is a survival mechanism for you.
It's my coping mechanism.
And when you were rescued by the police, and it was a raid of sorts. And when you were rescued, at the time, you were listed as a runaway.
Yes.
Right? Because of this message that you had written. Rather than an abductee, you were listed as a runaway. So when you were rescued, they actually put you in jail.
Yes.
When you eventually got back to your mother, how did you two get along?
After the situation, I went from one reality to another reality. And being isolated for so long, going back into society, it wasn't easy on me. I didn't go back to my mother's house, but coping with the family in general, I couldn't. I tried going back to school, and the minute that I walked in there, I walked right back out. I looked at all them children, and I thought to myself, like, I'll never be like them, you know, innocent with, you know, the glow of being childish and not having any worries in the world. And so I walked out. I never went back.
And how do you two get along now?
We're distant, and I want to clarify something.
Okay.
Okay, that was not the first time that Hope had taken off from the house.
Right, I understand.
Okay, so we didn't know if it was another weekend getaway or if it was going out partying and if she was going to come back. We didn't know. And she was on paper on probation. And so when I talked and I reached out to the probation officer, they advised me to call the police and file Hope as a runaway because that was my next step. Okay, she was never considered an abductee until after she was recovered. And then within the detention center, see, what happened to Hope was no longer Hope. She looked at these individuals as families and even protected them. So it wasn't simple to get her to cooperate. It was very difficult and was very trying. And I understand that she's not the same child that I had at one time, and she may never be that child that I had. Okay, so, and I don't think she understands what the ordeal that we endured as a family, wondering whether or not we were going to get a call or not.
Are you resentful towards her?
I'm not resentful.
You sound resentful towards her.
I wish that she would just, how can I put it? We're all victims. We're not all victims, but we were victims. I've gone through things. Our family has gone through things. And I've always taught my children to be strong. And that even though things happen, sometimes there's a reason that they just need to be able to try to learn to get help, overcome the situation, and face life head on.
I understand that. Why am I getting that you feel resentful towards her?
The point is that when I come to you at my lowest, on my knees, begging.
You don't come to your knees. You give me ultimatums.
Okay, no, I don't want your money and I don't want your time.
Why am I getting that you feel resentful towards her?
I'm not resentful towards her. What I'm resentful towards is that a family member that was causing a situation that became either financial burden or a crisis where my house was falling apart. My job, you don't know how much time. I had to meet with Homeland Security. I had to meet with FBI. I had to meet with the courts. I had to meet with like 3 different attorneys at different levels, going to the juvenile detention center, going to the county courthouse. And it's not that I don't love, I love it with all my heart. And anybody on your staff will know that I try to cater to her as much as I possibly can. But as soon as I say something or as soon as I do something and I don't meet what she wants, she's not the same person. How much more of that do I deal with? I love her with all my heart. Not once did I miss a visitation. Not once did I miss anything. If they said I needed to jump, I said, how high? I said, how high?
So you say that you're a victim too, is your point.
You don't understand. Who wouldn't?
You don't know what I understand. I'm asking you. You say you're a victim too. And I just want to be clear, you say you're a victim too, but you're not saying you were raped 20 times a day. You're just saying you're a victim too.
No, I'm a victim in the sense as me, not just me, her grandmother, a family that cared for her, that every night went to bed not knowing whether or not they were going to find her, not knowing whether or not she was going to be alive. Don't you think that is traumatizing enough? You tell me if your child goes missing and you haven't seen them in 2 or 3 weeks, and then the grandmother gets a phone call saying, they're beating me. You're not a victim? I'm not saying in comparison, there's no comparison.
Well, let me play a couple of the things you said.
Okay.
In your tape and I'll tell you why I responded. There are a couple of bites, things you said that I find unsettling.
Okay.
So let's listen.
You call me and you tell me you're hungry, you need money. If I had it like that, maybe. But when I'm 60 years old, is she gonna still come to me and say, I need $200? What's gonna happen when something happens to me and I don't have the financial means to take care of me? Don't we all have to work for our retirement? Don't we all have to save for our future? And if I'm constantly giving it out, don't you think that I'm a little bit depressed? Don't you think I'm a little bit discouraged? Don't you think that I'm a little bit worried about me? Is that selfish? I love Hope. I love her. But she's not the only victim. Let me respond. You know when this happened? This didn't happen a year ago when this happened. This happened 3 weeks ago. And 4 weeks before that, she asked me for $40. She's in one area of the state. I'm in another area. I told her if I could help you, I will help you. So I gave her money the first time. 2 weeks later, she gives me the money. You know what her response to me is? Is that if I don't help her, she's going to resort to what she knows how to do.
No.
How does a mother react to that situation?
First of all, I'm not like your other children that you do take care of. Because me, even though I'm 17 years old, I go out there on my own and I take care of myself. Whatever I want, I get it. But you know what? That's not the point how I get it. The point is that when I come to you at my lowest, on my knees, begging.
You don't come to your knees. You give me ultimatums.
Okay, no, I don't give you ultimatums, Mother. Like, that's not the thing. Is that when I ask you, okay, mother, I would like for you to help me out with $40, did I ever ask for anything more than that? You know what? And at the end of the day, that's all I'm getting is the 20 and 40 bucks here and there. I'm not asking for much. And even that, I don't even call you. I don't talk to you. I don't even want your money. I don't want your money, and I don't want your time.
Hope, I don't even have the money to give you.
Okay, Hope says her mom wants her to just move on with her life and forget the past, but is it that simple? I plan to let her mom and Hope know what I think when we come back.
She cannot continue living the life she is and be productive at the same time.
My mom has never been a shoulder to cry on. It's never been about what I've gone through or what she's put me through. It's always been about her and her problems.
At 14 years old, Hope was abducted and held against her will and became a victim of sex trafficking. She was lured out of the house while her mother was home and in the other room. So after being rescued, is Hope's mom more involved in her life, or is there still distance between the two?
I do try to listen to Hope when she wants to talk. The difficult thing is that she just wants me to listen. There's a lot of pain inside of her and there's a lot of anger, and sometimes she takes that out on me. When I do try to engage her, it gets on her nerves, and so she lashes out. But she really needs to heal. Even as a traumatic situation as hers, life is still gonna go on. Someone's gonna have to pay the bills. She cannot continue living the life she is and be productive at the same time. She's still a victim, and she never got herself together.
My mom has never been a shoulder to cry on for me. It's never been about what I've gone through or what she's put me through. It's always been about her and her problems. That's all she cares about.
Okay. I'm just going to kind of do some talking here to the two of you, and let me start with you. The trauma in your life and in this family didn't begin the day that you were abducted. We know that. We know that there were a lot of things that happened in her life before this. We know that this family has had a very difficult time along the way.
Yes.
And do I not, you asked me, do I not think it would be traumatizing to have my child abducted and all? I'm not going to tell you I know how that would feel because I don't know how that would feel, and until you've been through that, for me to tell you I know how you feel would be ridiculous. Unless you've been through that, unless you've gotten that phone call, unless you've been through that, you can't imagine that. So yeah, I think that I can only speculate that would be very, very difficult. I can speculate how I would feel if I ever got my hands and arms back around them again. I understand that life is difficult and it is trying. I know this was a difficult relationship before this happened. I know that it's been a difficult relationship trying to reconnect after it happened. And one of the things that I know for sure is when these things happen to people, it affects more than just the person. It affects everybody, and the fallout goes for a long time and a long way, and it affects everyone. And I hate that for y'all. I absolutely hate it. And it leaves scars that run very, very deep. We know that this wasn't the first trauma that has occurred in your life, and things have happened that have changed you. And frankly, you've not had much help with that. You've found a way to cope. You found a way to survive. You found a way to cope with that. And it's gotten you through. You're still here. You're still vertical. But you're 17. You're still a child. And we also know that when this kind of trauma happens, a lot of development stops. And so even though you're 17, a lot of development stops. And so you've not had a lot of help with this because it takes very specialized help and very specialized healing to get past this. I don't want this to define you for the rest of your life. What happened to you early on in your life, not once but twice when you've fallen victim to predators in your life, I don't want that to define you. I don't want this to define you the rest of your life. I don't want that to happen. You are so much more than what people have done to you, and to let that define you would be a tragedy.
I'm not a prostitute. I have men that take care of me like sugar daddies. In order to survive, I'd meet some poor guy that would fall in love with me until they realized that I hated their guts. For me, there's no such thing as love. And I don't get any pleasure from sex. When I'm with a man and there is sex involved, they know that they are going to pay me. I'm not a prostitute. I have men that take care of me like sugar daddies. In order to survive, I'd meet some poor guy that would fall in love with me and take care of me until they realized that I hated their guts.
Somebody in this world with the right intention needs to step up and help you. And I want to lead the charge in doing that. I want to help you. I've asked someone to be here, right here. This is Kathleen Parrish right here. She is the clinical director of the Cottonwood Treatment Center. And this is a holistic behavioral treatment program. And they've been at this for over 25 years. And they provide really an environment of understanding and safety. It's located on a 35-acre, really a scenic campus overlooking Tucson. And they got a long history of working with people that have suffered from PTSD, particularly victims of sexual abuse. Because, as I say, it's very, very specialized, and we asked them to come here today, and just wave Kathleen so she can see who you are. And I want to offer to you to sit down with Kathleen when we finish today, because I want to make available to you to work with these folks from Cottonwood to help you get on the road to dealing with this, not coping with it, not creating an alter ego to tough through it, but to truly heal this from the inside out and give yourself a chance to be who you truly are. And that's just a gift from us to you, and I want to make that available to you. This is not something that you have to do. It's not something, but it's just something that I want to offer to you, and that I want you to sit down with Kathleen, because you can really help this in, don't you think, Kathleen?
Yes, I think so. And I think helping, you hope to learn to integrate your story into how you understand yourself so that you don't have separate parts of how you operate. And at Cottonwood in our Sweetwater program, you have 90 days and a lot of help, a lot of supports to learn to tell your story. Telling your story over and over and over again helps you learn to understand yourself, to learn your resilience, where you're powerful, where you're strong.
And you can go through details about this, and you can listen and be part of this. And I think this would be a huge life-changing event for you. I just think it would be
If I can add, you were right. Hope's been a victim. And at 6 years old, I put her in counseling. I was going through a custody battle at the time and dealing with the courts again. During this incident too, we followed through with counseling as well. But in order to heal and in order to get the counseling and for it to be effective, she has to be receptive and willing to work at it. And it's not easy. And I don't think that she wanted to face it because the hardest thing that she told me, and when they had her in custody the first time, when we go to detention and we go to court, we're not supposed to touch them. But I did ask special requests to be able to give her a hug, and I did hug her. But because she was in custody for something else that she had done prior to this incident.
Okay, what's your point?
My point is that
because we're trying to move forward.
I understand I'm trying to move forward, and I appreciate that. But at the same time, we did try this before, and I'm hoping that she'd be receptive to accepting it and being able to understand that it's much needed.
Okay, thank you. Up next, is Hope's mom helping or hurting this situation?
I do believe that I have the right to explain why I react the way that I act today.
And I think you've explained that several times.
All right, but I don't think that you've actually received it.
When you get a guy's attention, you might feel really important for a few minutes, but popularity is not the most important thing in life. You can feel good about respecting yourself and not giving yourself away to people who don't respect you.
So at what age is it reasonable to monitor your child's cell phone and internet activity? As long as you can.
It blows my mind that women would engage in risky sexual behavior. It's dangerous and you can get hurt. And you don't have enough value in yourself that you would want to be in a healthy relationship.
Okay, I'm back with Hope and Desiree, but before we move on, you were telling me you're unhappy about something. Tell me what
No,
it is.
it's just that I appreciate the gesture. I am blessed to know that someone will help my daughter. Okay, but I don't want to say also that the opportunities weren't there. There were several different facilities and several different places that we attempted and we tried. And I know we're moving forward. And even when she was released, she was still leaving the home for days at a time. I was still going through the nightmare.
I found my comfort in other people's homes.
We're really wanting to move forward.
I understand, but if you put me here, then I do believe that I have the right to explain why I react the way that I act today.
And I think you've explained that several times.
All right, but I don't think that you've actually received it.
Well, I've heard you several times.
I know, but I don't think you're actually understanding where I come from.
You mean I don't agree with you?
I'm not sure if you agree or disagree, but I don't think you understand.
Okay. Well, you don't. You've told me several times.
I know.
Would you like me to tell you what it was you said to me so you know that I've heard it?
No, believe me, trust me, I appreciate it very much, and I appreciate your hospitality. I said, but even the exposure here alone, yourself will be able to be a testimony and witness that it's very difficult at times. I love her, but it makes it almost impossible when somebody keeps hitting you and hitting you and hitting you. What do? Do you continue taking the beating?
Yeah, I did.
Okay.
Do you understand where I'm coming from now? I told your staff, I'm not a trained lifeguard. I can't jump in and save someone if they're drowning.
Where do these two go from here? We'll talk about that after the break.
Paint whatever picture you want. That's fine. I'm just telling you.
You've got the paintbrush, and the next sentence out of my mouth was that I want to offer you help and support with this as well, because I think there's a lot of stress and trauma that you've been through as well, and I think you need help and support as well, and I want to offer you the same thing.
I was on my own at 14. The only difference between me being on 14 and you being 14 was I was able to get a job, and I was able. I'm 40 years old right now, and when I was your age, I was able to find a job, and finally, long story short, I was in a foster home. So when I sit there, I'm not trying to be harsh. I live what she lived, but not to the extent that she did. And I understand it, and I love you. I just don't understand if you receive the fact that I've loved you from day one. From day one when you were 6 years old, and the incident happened, and you told me, Mom, why did I go through this? And the only thing that I told you was, what did I tell you? I told you, you know what? Sometimes God allows things to happen because you're strong. And you saved what? You saved another little girl that was going through the same abuse every single day. I jumped through hoops, that I fought for counseling. I fought for help.
Well, do you think you would benefit from some help and support where you had a chance to really give a voice to some of these feelings you deal with?
I just want my daughter to be better. I don't care what it takes. I just want my family to be better.
Well, I'm offering you some help and support with this yourself, so when she emerges from this in a different place, that you'll be able to meet her on a different plane.
Definitely.
And so I'm offering you that help if you want it, and I hope you take it, because I want you to be able to meet her on a different plane.
I want my family. And I want my
So
family.
I'm offering you that help. Will you take it?
Sure.
Because I'm offering you that help. I wanted to see what you at home think about teens making their personal lives public. So we ask on drphil.com, do you think young adults share too much about themselves on social media? Results? 96% yes, 4% no. Surprise, surprise. Listen, I want to thank all of my guests today. A special thanks to Kathleen Parrish and the Cottonwood Treatment Center and their outstanding ability to help young adults struggling with trauma. You can learn more about them by going to their website, and we're going to have a link on drphil.com as well. We'll see you all next time. Thank you so much.
I am grateful for Dr. Phil because I hope he talked some sense into my mother. He also, was able to see my side of the story. He really did understand that this isn't the lifestyle that I chose, that after being traumatized, it's hard to just jump back into the way of life.
I love Hope, but she's not the only victim.
My mom's always only cared about herself, her money, and how she's gonna survive. But when it comes down to it, she doesn't really care about how I'm surviving. The plane ride back is going to be bad because my mother is probably either going to be crying the whole time or cussing me out the whole time.
I was a good mom. I did the best that I could by my child. If she wasn't willing to accept my help or anybody's help, that wasn't my fault. I came here because this was the first time that she wanted to share her story. I just didn't know she was going to manipulate it or twist it to one side. But if it means that she gets the help that she is, then it's not in vain. My crying is fine. I'll deal with it. If it means her getting help, that's fine. I'll survive this. It hit me. I'm dealing with it. I'm crying. And as soon as I cry and as soon as I let it out, I know that tomorrow's coming. I can't take time off for this. I can't dwell in this as of tomorrow. Yeah, I'll think about it as of tomorrow. I'll hurt over it. But guess what? I'm planning on doing my job and pray that God finds a way, to make it right.
Today on an all-new Dr. Phil.
We're going to be dishing out some 5-minute fixes.
Fast remedies.
My husband is a hypochondriac.
I'm driving myself crazy. You're not crazy.
For a better life.
She has had 6 nose jobs.
I've never been happy with the nose.
I have a quick fix. 5-minute fixes.
I am afraid to go to a gynecologist.
You trust Dr. Masterson.
I feel like I know her.
Yeah. Would you like to know her better? This is going to be a changing day in your life.
Have a good show, everybody. Here we go.
It matters to you. That's what I want to talk about. Are we ready in the booth? Let's do it. Go, Dr. Phil. often said that we don't do 8-minute cures on this show, but today, well, that's kind of an exception, because we're going to be dishing out some 5-minute fixes to some things that really crop up in your life a lot. Throughout the show, we're going to be giving you some of the most efficient, effective ways to better your health and expand your lifespan. But I'm not going to do this alone, because joining me today are America's medical dream team. You know them as the host of the Emmy Award-winning daytime hit, The Doctors.
Doctor, give me the news.
Make a fist, and you're going to grab inward thrust.
This right here, that's your frontal lobe.
That is such a cool thing.
Lift the bone. There we go.
Trying to keep the computer from scoring here, Travis.
Pretty cool. Very quickly, 100 per minute.
Hey. Don't you do to me what you do to him?
I don't want to die. I'm not going to pass.
I wanted to say thank you to all of you.
Please welcome Dr. Travis Stork, Dr. Lisa Masterson, and Dr. Andrew Orton. Good to see you. So much. Good to see you. Yeah, all right.
Thank you, thank you.
All right, now. Thank you. All right, now. Dr. Jim Sears, also a cast member here, couldn't be here today in person because, well, it's flu season, and that's like tax season for accountants. So he couldn't get out of the office because he's got little kids lined up around the block with flu, and we said, stay there, we're going to have him here by video. But he sent along some of his quick fixes for everything from flu-proofing your family to lowering your blood pressure, and we're going to give them to you throughout the show. But first, Dawn wrote to me because she says her husband, Randy, is a hypochondriac. And she says she just can't take it anymore. Take a look.
My husband is a hypochondriac.
I think about my health all the time. Every night when I come home, I'm usually on a computer for 1 to 2 hours, just searching for different remedies.
Randy has researched anything from having a heart attack, gout, kidney failure.
Anytime I feel a pain in my body, right away I think the worst. If I start to get a pain in my calf, that could be a blood clot starting.
If Randy has a sore throat, he thinks that he's got cancer of the throat. If Randy gets a pain in his arm, it's definitely a heart attack. If Randy has a bad headache, it's always a brain tumor. Randy constantly checks his pulse. Sometimes he even checks mine to see if mine was as normal as his was. We have a daughter who is 7, and he was also testing her.
I'm very afraid of dying. A lot of nights I don't even want to go to bed because I'm worried I might not wake up.
We've gone to the emergency room probably once every 4 months because Randy thinks that he's having a heart attack. Randy has never had a heart attack. If Randy doesn't seek help, I really have a feeling that he's just going to drive himself crazy.
Is there something that I can do where I wouldn't be so consumed about my health and about dying all the time?
Okay, now this is interesting because you realize that what you're experiencing is not rational.
Correct. I'm driving myself crazy over it, really.
Okay, and Dr. Stork, that's not usually what you hear from someone that describes himself as a hypochondriac. They come in and they think, no, I am dying. This isn't craziness, I'm dying.
Right. So you at least have some insight. But the one thing that you know is if you obsess about your health, that's not healthy.
What do you understand hypochondriac to mean? I got a feeling you know the answer to this, but what do you just think it means?
Well, constantly worrying about your health. You know, every time you get a little pain, it's more than just a pain. If I get a pain in my back, right away I think the worst, that it could be kidney failure, my liver's going out, or I have a tumor growing, or, you know, something like that.
What's your payoff for this? What do you get out of it?
A lot of stress.
No. You get something out of it. Look, people don't do things over and over and over again if they don't get some reward for it. Are you a drama king?
No, I don't think so.
Well, but yeah, how can you say no, but a muscle twitch is a heart attack? I mean, isn't that drama?
It is.
He's a drama king in the sense that he's going to do research on it and find out what it could be.
Randy does have some actual health problems, but he refuses to follow his doctor's orders when he does have something wrong. Take a look.
Instead of following the doctor's advice, Randy reads what other people write on the internet and follows their advice. Randy has battled gout for approximately 15 years. Randy opted not to take the prescribed medication and just do his own remedies.
I take black cherry extract twice a day. I also do take turmeric.
Randy found that lemon juice and water is supposed to help with his gout. At the end of the day, the gout is still there even after he's tried all these internet remedies. All the remedies that Randy has bought just sit in this cabinet, and even if they're expired, we can't throw them out because at some point Randy may need that remedy again. I think Randy needs to get to the doctor. He needs to take some blood tests and find out really what's going on with his body.
Okay, now actually there are some things that you can do on your own to manage your health, of course. In fact, Dr. Travis Stork and the doctors have put together a new book called 5-Minute Health Fixes, and it's full of easy tips to improve your life. I was asking you about your payoff. What do you think I mean by that?
I don't know. I really don't know. I don't think there is a payoff. Worrying.
What do you think the payoff is?
I don't see a payoff in any of this.
Well, just assume for me that we don't do things repeatedly that don't pay us off.
Well, I'm guessing that, yeah, he's relieved when he finds out that, you know, the symptom is gone and he's okay in his own mind.
Am I missing something here? Do y'all get what I'm saying? You do stuff because it works, right? You get something out of it. You do it because you get something out of it, right?
No, I really don't.
I see a lot of people in the emergency room who have symptoms and they accentuate them, especially nowadays, because you can go online, punch in a symptom, headache. Next thing you're reading about a brain tumor, and then you'll come to the emergency department and you're telling me you have all the symptoms of a brain tumor, not because you have them, because you read about it and convinced yourself you have them. So it's a dangerous time.
We've even developed a new term for that. It's called cyberchondria. Okay? It's called cyberchondria because people go into cyberspace, they look all of this stuff up and are highly suggestible. So they read all of this and go, oh, yeah, I have that. Oh, yeah, I have that. I do. And so they self-diagnose at that point and then become very stressful.
Sure.
And that you do that some, don't you?
Oh, I do it a lot. I do it a lot, yes. Yeah. I mean, almost probably every night. I mean, you know, if I'll get a pain in my side, then I'll go online and research it. And, you know, then they tell you about a appendix and your appendix going bad and the short one where you can die and it can explode. And so it's like, you know, how long do you wait? Should I go to the doctor? And shouldn't I go? And so, you know, when the pain goes away, it's like, ooh.
So when you look all of these up and it turns out you don't have them, you're relieved.
Well, I don't know that I don't have them till the pain or symptoms go away. Then I'm relieved.
I think I'm getting a brain tumor. Dr. Travis says that you should only use valid websites to research conditions that you have actually been diagnosed with. You know, wait till you're diagnosed, then do your homework, then do your research. Now, if you go to drphil.com right now, we're going to have a list of them for you there. Now, next, I'm going to tell Randy what he needs to do to stop stressing about his health and to really control this, because it really is disruptive to your life. And later, a woman who's thinking about having her 7th nose job. We'll be right back.
Randy has this vitamin case that he carries with him every single day.
I have turmeric in there. I have pantheoathic acid, aspirin I keep in there at all times for heart attack. If I don't have my vitamin pack with me, I start thinking what happens if I start to have a heart attack or chest pains or whatnot. Then what am I going to do?
We were going to go on a cruise, and they were predicting bad storms, and Randy was worried that if he got on that cruise ship and the water was a little bit rocky or wavy, that he was going to have a heart attack and he wouldn't survive. So we had to cancel our trip.
This isn't malingering. He's not faking this to get out of doing something or going on a cruise or whatever. This is very real to you at the time. And your concern is very genuine, right?
It is.
And it's very stressful to you.
Oh, absolutely.
At the time. And often underlying this is anxiety. And it's not anxiety about any one thing. It's just stress and pressure, and it has to find an outlet. And in this case, the outlet has seemed to be an overemphasis, an overfocus on symptoms that are misinterpreted as being something more serious than they are. What you have to be willing to do is to accept that this is from something else, and that something else is anxiety. If we can teach you how to manage anxiety without having to get into this cycle of build, relief, build, relief, build, relief. If we can teach you to do that in a more constructive way, then your need, subconscious or otherwise, for overemphasizing this symptomatology would go away. One of the ways that you do this is through what's called biofeedback training.
Okay.
And you are so attuned to your body, where you listen to your body so well and you focus on it, that those skills can actually be used very productively to help you gain control in this other area. You're not crazy. This isn't some kind of bizarre mental illness here. Okay. You need some alternative coping skills to handle this. And if I arranged that for you, would you do it?
Absolutely.
To get you some biofeedback training and get you some ability to manage this anxiety, you would do that.
100%. Sure.
Dr. Travis Stork also has some advice on when you should go to the emergency room, because I don't want people to get the message that you just ignore all of these things. You overreact to it, right?
I do.
If you're in doubt, you do want to get it checked out. No question about it. Let's say you're suffering from a headache. You know, if this is acute onset of the worst headache of your life and you have confusion and fever and a stiff neck, or let's say you've lost consciousness and you have a continued headache, you want to go get that checked out. Don't minimize that. Or let's just say you're at home and you have nausea and vomiting and severe diarrhea. You can't keep down fluids. You can get dehydrated very quickly. So don't be a minimizer and say, oh, I'll be all right, even though I can't get out of bed. So there are times where you have to listen to your body. But you prove to be challenging for doctors like us because we don't know when it's real or not real. That's why you need to get this fixed.
Absolutely.
And these are things that you guys cover in the book, 5-Minute Fixes. There are some of the things in there that you just need to know, so you know when to pull the trigger and actually go to a doctor versus when not to. We're going to approach this from a different area. We're going to look at what's underlying this, take that need away, and I think you're going to see this dissipate in fairly short order.
Great.
Okay?
Very good. Great.
You'll be relieved, right?
Absolutely. Yes.
All right, good deal. All right, next, she's 20 years old and is terrified to go to the gynecologist. Plus, how to enjoy your holiday cocktails and not get that hangover. Yeah. But as we go to break, here's Dr. Sears with a tasty 5-minute fix to lower your blood pressure.
Hey, Dr. Phil. Hey, doctors. Here's some great news for all those chocolate lovers out there. You can actually lower your blood pressure by eating dark chocolate. An Italian study found that if you eat one small piece of dark chocolate every day for 15 days, you can lower your blood pressure by 6 points. And it significantly enhances your body's insulin response, which is a key at preventing diabetes. But remember, we're not talking about the whole bar, just one small piece.
Alicia, and Allison.
Our question is, how do you cure our hangovers?
After a night of drinking, I'm usually on the bathroom floor the entire next morning being sick.
I usually go to the bathroom numerous times throughout the night to throw up.
My hangover means I spend the entire next day in bed. I get terrible headaches and experience light sensitivity. Please help us.
Dr. Travis, is there a way to prevent a hangover? I mean, can you do it?
Obviously, moderation, drinking water in between drinks, but there's no magical cure for the hangover.
So water, is that to reduce the volume that you drink, or does it just water it down?
Well, a little bit of both. You're staying hydrated because alcohol can dehydrate you, so the last thing you want to do is wake up the next morning severely dehydrated with your hangover.
My next guest, Christina, wants help getting over her fear of going to the gynecologist. Take a look.
Hi,
Dr. Phil and Dr. Lisa, I need your help. I am afraid to go to a gynecologist. Ever since I got my period when I was 10 years old, I've dealt with terrible menstrual cycles. I would get pain so bad, hot and cold sweats, the shakes, I'd vomit, I fainted, and had to seek emergency medical help. Every time I think about going to a gynecologist, I freeze, I fight it, I don't want to talk about it. It terrifies me to let a stranger see me that way and touch my private areas that I know it needs to be addressed. 10 years is long enough.
Okay, now my goal is to talk you out of this fear. But, Lisa, the truth is, this has got to, I mean, she has a point, right?
Oh, absolutely, and that's a lot of reason why a lot of women take a lot of time not to go to the gynecologist. It's difficult for a woman to reverse her mindset. There's a stranger, she's going from the pediatrician to the gynecologist, and that's a huge leap for a woman.
What do you think is going to happen that's bad?
I just feel like, from what I've heard of going to the gynecologist, it's basically you get into a room, you take off your clothes, and you let a stranger touch you. Like, what? Like,
No. You just described going to a bar. That's not what happened.
That's what women think. It's all about you taking control of your health and your body, and that's what we have to switch it to, is that you're actually in control of your body, and this is a good thing.
Let's take just a second and talk about the downside of not going to a gynecologist for as far into life as she is.
Now there's an HPV vaccine. We can keep you actually from ever getting cervical cancer because of STDs. So the consequences with STDs are not only that you may have an embarrassing sexually transmitted infection to talk to someone about, but we know it can cause infertility, it can cause severe pelvic pain, it can cause death in certain instances, depending on what you have.
And you have a lot of pain, actually, right?
Yes.
Okay, now your sister Laura has actually tried to trick you into going to the gynecologist. How did you do this?
I've tried to make a lunch date with Christina, go out to lunch, then happen to pull into the parking lot, and then the door's locked, and she's like, I'm not getting out. I've made appointments for her. I've even offered for her to come in and watch me get an exam so she can see exactly what goes on.
Well, that's a generous and fair offer.
And I know she's concerned. You need to go first just to meet the doctor, and that's okay, and then go for the exam second, because the indication for an actual exam is if you're having problems, like if you were having cramps, or if you're 21 or sexually active, whichever comes first. So that needs to happen.
And I've asked Robin about this when we were having our first baby and everything. Do you feel funny about this and all that? And she said it very well all those many years ago. She said, if you go to a professional, they are professional. Your modesty is respected. You know, you're draped, you're covered, you're not vulnerable in some way. People aren't coming in and out of the room. There's complete and total privacy, respect, and professionalism. So this isn't something where you have to feel that you're going to be disrespected or exploited, or anyone even being insensitive to your concerns.
We tell you exactly where we're going to touch you at any time if you want to be touched. Again, it's all about you being in control.
Now, you said you actually trust Dr. Masterson because you watch her, right?
Yeah, I've watched the doctor show for several years.
So you feel like you know her?
Yeah, I feel like I know her.
Yeah. Well, would you like to know her better? Let me tell you why I'm asking that. Because you watch the doctors, you know that the doctors has an exam room, a very professional examination room, no cameras. No cameras, just cameras to kind of introduce people. Here it is. See it right here. Wouldn't this be a great time with a doctor that you feel like you know and trust to go and have that first preliminary exam and get it over with?
Yes, it
would. You do that?
Yes, I think so.
Are you willing to do that?
Yeah, I'll try.
All right. Up next, she had 6 nose jobs and now wants a 7th. Plus, how to flu-proof your kids, and then we'll hear about how this goes by the end of the show. We'll be right back.
I've had 6 nose surgeries, and I am still not happy with the results. I was always hoping it would be the last surgery, but there was always something that I was disappointed in.
Here are a few really important tips to keep you and your family healthy during flu season. First, you gotta eat well. Lots of fruits and vegetables and lots of fish. Those things really boost your immune system. Next, you gotta exercise. Staying active will boost your immune system also. Prevent the spread of germs. Have a little hand sanitizer in your purse. When you pick the kids up from school, have them use it. And if they're gonna be coughing, you teach them how to cough the right way. Don't cough into your hands, kids, because that's gonna spread the germs also. Cough into your elbow. I call this a birdie cough. That's how birds cough. Or, for the older kids, a vampire cough. Whoa.
That was Dr. Sears from the Doctors. That was a great tip, and you can find more great advice in their new book, 5-Minute Health Fixes. Now, my next guest, Cynthia, says that she has had 6, count them, 6 nose jobs, and is now contemplating a 7th.
I've had 6 nose surgeries, and I am still not happy with the results. Growing up, I was not a pretty child, and I was never happy with my nose. I had been wanting to trim it down and make it look more feminine. I had my first procedure done in 1981. I didn't feel that the difference was appreciable. The second procedure was done in 1984. I was not happy with the result. I had a 3rd surgery. In 1996, I found a teaching hospital in my area. I had 3 procedures done at this hospital. After all the surgeries I've had, no one has ever said, "Gee, you're looking good these days." No one's ever noticed. I wish the doctors had listened to me more. I have never felt that they have done what I asked for. After 6 surgeries, I wonder if my nose could handle a 7th one. I would like to know if I should have a 7th surgery or to leave well enough alone.
Okay, what's your gut instinct tell you?
That it should have been corrected the 1st or 2nd time.
How does this happen, Dr. Orden?
Well, you know, that's the thing. I think for plastic surgeons, nasal surgery, without question, is the hardest procedure that we do. And you can do a perfect operation and not get a perfect result. Your first procedure you had done, you were still a younger woman, and you just wanted a little definition in your tip, correct?
Yes.
What happens every time you operate on a nose, altering the anatomy, in spite of an ideal surgery, things can settle in a funny way. The patient's not satisfied.
Oftentimes, patients will have a problem with self-esteem, they'll have a problem with self-confidence, and they'll kind of target that into one body characteristic, and they'll kind of become obsessed with that. Do you think that your focus on this over all of these years is to the point of being counterproductive, point of being obsessive?
It's absolutely excessive. I don't know about obsessive. I may have been preoccupied with my nose, but in general, I'm a very happy person. I'm accomplished, but I've never been happy with the nose. Without makeup, I still have a very homely face. I was taken for a boy several times, all through my childhood and 20s. Yeah.
Is that part of your motivation, that if you had a finer line nose, that you might look more feminine?
I just wanted a more feminine nose.
You know, we see this with nasal surgery, that you go so far, but you're not quite there, and you want a little more. So we do see this, but you know, each time you do an operation on the nose, it's more difficult to change it.
Well, something
going further
that jumped out to me, and tell me what you think about this. You said the first one was done at age 30, but then you said numbers 4, 5, and 6 were done by a resident.
It was done at a teaching hospital.
You know, and I know where it was done. Excellent facility and excellent institution. And the point being here, when you get to the point of 4th and 5th noses, those are probably not best done by a resident. A resident is just not in a position to handle that because that's a very difficult case.
One of the things that I did in practice is plastic surgeons, if they had a question, they would sometimes send them to me for evaluation to determine whether or not there would be a possibility of a good outcome. So I've been in this situation a lot. And had you come to me and I'd evaluated you to make a recommendation to the surgeon, I would say not just no, but hell no. You don't want to do this. I mean, if this went badly for you in some way, you would have taken a situation that is wonderful and taken the risk of going really, really wrong.
Dr. Phil, you're talking like a nasal surgeon. In all fairness to her, a couple of these procedures that she had done were related to breathing problems. That the nasal surgery that she had initially ended up giving her breathing problems she didn't have. And that's a little bit of a vicious cycle that we see with noses. That's why it's so important to identify those going in.
Well, we have a photo here of Cynthia's profile. And so, Dr. Worden, I mean, tell us what you think.
Well, you know, and I think we're all in agreement. Who would say that she looks pretty good here? And seeing you know, I think that your tip projection is pretty good. You have a nose that fits the rest of your face. I have a solution for you, a quick fix, and all it involves is an injection, not in your nose, but in your upper lip, your premaxilla. And what it entails is just bringing out your lip. Do you see that? And what that does by doing that, by bringing that out slightly, it makes your nose look a little bit shorter. It gives it the appearance of being deprojected. And makes it look better. Without touching the nose, a quick fix, which will give you a little better look, and I think help you your biggest deal. You still feel your nose looks too big.
That makes sense to you? Would you consider that?
I would absolutely consider that.
Then can you do that?
I can do that.
All right, we'll do that for you.
We'll do that for you.
All right? Yes. Big stuff. All right, coming up, we're talking about how to eat less sugar and have better sex, but not at the same time. We'll be right back.
Here's one of my favorite healthy food substitution tips that your family might not even notice. Instead of using sour cream, try switching to low-fat Greek yogurt. It's so much healthier for you. Serving for serving, low-fat Greek yogurt has less than 1/4 of the fat, 1/3 of the calories, and 3 times more protein than sour cream. So whereas sour cream is actually bad for you, Greek yogurt is good for you. Why not make the switch? As a matter of fact, a few weeks ago, I was kind of tricky with my family. I emptied out the sour cream container, poured in the Greek yogurt, served it with our tacos, and nobody knew the difference.
Hi, Dr. Phil. Hi, doctors. I eat way too much candy. Ever since I was little, when I would go to restaurants, I would eat the sugar packets right off the table. As I got older, I would spend about $30 on Skittles, Sweet Tarts, Smarties, and Fun Dip, about 2 to 3 times a week. I began to try to cut out candy. It only lasted 48 hours. I couldn't get out of bed. I had an awful headache, and I feel like I crave sugar. Is it all in my head? How can I end this sugar addiction?
All right, well, that was Emily, who wants to know how to break her sugar addiction. And here to help me answer that question are 2 of the hosts of the daytime Emmy Award-winning hit, The Doctors. Now, they put together a new book called 5-Minute Health Fixes. Emily's going to join us via Polycom. Emily, are you there?
Hi.
Hi.
Hi
now,
there.
You know you're eating a lot of sugar, right?
Yes, it's a major problem that I know I need to stop.
Okay, and you've been doing this for how long?
Ever since I was really little. It got bad once I got my license, though, and I could just go get it on my own.
You're eating 12,855 teaspoons of sugar a year. Year. And that's over 600% of what is recommended for her to be taking. Travis, what do you think?
The problem is nowadays you can pick up a package of anything on a grocery store shelf or soda that's loaded with sugar, and it's a reinforcing cycle because it actually increases the release of neurochemicals that give us pleasure.
Right. I said you were eating a lot of sugar. Do you have any idea what that looks like, 12,855 teaspoons?
I have no idea.
Well, let me show you. Let me show you. Because we are talking about a lot of sugar. Are you surprised?
Wow.
Is
Is this why we have Emily on Polycom? Because she starts salivating?
Think about this. Whoa! You're putting that into your body day after day after day after day after day.
You know, Emily, I'm going to appeal to your vanity. We know that eating too much sugar in the diet has a bad effect on your skin and aging. I mean, that's for sure. So that's another reason why you've just got to nip it in the bud.
Every year that we go through life, our metabolism slows down. So when you're a 19-year-old, your body is primed to use sugar as the main source of energy. But the longer we go through life, the more hours of TV watching we do on the couch, what happens is that sugar settles around your belly. And it creates something called visceral fat, which leads to heart disease, diabetes. I think the biggest issue here is Emily, just like all of us, we're getting a lot of sugars in things that we don't even realize.
Yeah.
Your pasta sauces are sometimes loaded with sugar. When you go buy processed crackers, loaded with sugar.
Okay, now, Emily, here's the thing. You need to understand this is a form of addiction. After you get this out of your system and then you start to eat it again, it's going to seem really sickening to you. Emily, do you think you could go cold turkey on this?
Well, I've tried, and it was a complete failure.
But here's what you got to be willing to do. You got to get the people around you. You got to get your friends. You got to get your family. And you got to tell them, you need to treat me like an addict for about 3 or 4 days here and pat me down when I come in. If I got a Kit Kat bar on me, take me down and get it away from me. And you've got to resolve, you know, for 72 hours here, I'm going to do it. And I promise you, if you'll get through those first 3 days, you will be a whole lot better off. Fair enough?
Fair. I can do it.
We'll see. I want to hear from you after 72 hours, okay?
Okay.
All right. Where's Maria? All right, Maria, you have a question. What is it?
I wonder why guys have it more difficult for an orgasm when they're drinking, but at the same time, it feels like they're more interested of having sex.
Okay.
Who gets to answer this one? I'll arm wrestle you for who gets
you win. But how about this? You answer the first part. Why, after a few drinks, is a guy more interested in sex?
Well, obviously, because it's just relaxed him. It's decreased his anxiety level. He's free and easy and relaxed.
And after a drink or two, both men and women, they do relax. And so it can be a bit of an aphrodisiac. But the problem is alcohol is a central nervous system depressant. And you need your central nervous system as a guy to make things happen down there. And the more you drink, the less you're able to do that, because the depressant action of the alcohol is saying, all right, this isn't going to happen. And so the guy may want it to happen, but it just can't.
It also distorts their self-perception. Because they may look like Pee Wee Herman, but after a few drinks, they think they're James Bond. So, and they walk in and say, yeah, every woman in here is looking at me. All right, when we come back, a mom who needs a fix for stinky feet. Plus, we're going to find out how Christina did in the lab next door at the doctor's. We're going to hear from Dr. Lisa. Find out what happened. We'll be right back.
I'm Erica, and this is my daughter Layla, and our problem is we have stinky feet. Layla's only 8 months old, and her feet already stink. And I've been dealing with the issue since high school. I've tried powders and sprays, I've tried different shoes, different socks, and nothing seems to work. They pretty much smell like garbage. And my husband even makes me wash my feet before I go to bed. Can you help me?
Well, that was Erica with actually a very common but yet embarrassing situation, but luckily there is a solution, and Mel back here is actually soaking in this. So, Dr. Stork, tell us what she's doing. Obviously, she's in some, it's just regular tea?
Black tea?
It's black tea.
Black tea.
So if you brew up black tea, a big batch of it, pour it into a foot bath, let it cool, obviously, and soak your feet for about 30 minutes. Not only is it soothing and relaxing, but the tannic acids in the black tea will actually help dry out those sweat pores and kill off the bacteria. Because the bacteria that grow and feed off that sweat, they release the odor. It's not your feet, it's the bacteria's fault.
You've been soaking in this for how long?
About just maybe 2-3 minutes. It smells great, great aroma.
How often do you have to do this?
You should do it every day for a week. And then after that, as needed.
All right, now, before Dr. Lisa answers another question, I need to find out how things went with Christina in the doctor's lab. So, how did things go?
She did great. She just flew through it, and I know she feels so much happy about it, and she just, everything's healthy, and she just did fabulous.
So, first off, you didn't find any problems at all?
Didn't find any problems. Everything's nice and healthy, perfect. She just breezed through that.
How do you feel about having gotten it done?
Much better.
You feel relief that you're through that?
Exactly, especially since she said everything looks good.
Well,
so that's like, whew, thank gosh. But it wasn't as bad as I thought it would be.
All right, we have another question for Dr. Masterson about menopause. Judy, where are you? What's your question?
I'm wondering if it's okay to go off of estrogen, just cold turkey, or do I need to wean myself off of it?
That's one thing you don't want to go off cold turkey, because if you go off cold turkey, it's going to kick you back, you know, it's going to give you a little kickback, and you're going to get hot flashes or other symptoms that you had back with a vengeance. So that's something you want to wean yourself off of. So talk to your doctor about how to wean yourself off of it, what's the best for you. So yeah, don't just stop cold turkey. We want you to be on the least amount as possible for the shortest amount of time. That's the recommendation now. So you do want to wean off eventually.
Okay, thank you.
Cool. All right, we've got one more question from Deborah about burns. Deborah, what's your question?
What is the proper way for us to treat burns? Because I'm tired of soaking myself in fat.
People of color are more likely to form scars, so treat a burn the right way from the get-go. And we get into this a little bit in the book. I don't know if you've heard this wives' tale. Number one, don't butter a burn. That if you have an acute burn, you don't want to put butter on it. That actually can help promote the burn to be worse and lead to infection. The best thing to do is to immerse a burn in cool water. After that, if you have a second-degree burn with a blister, don't pop it. Let it just rest there naturally. You want to apply something moist in the form of aloe or a triple antibiotic ointment. That's a good thing for a burn. And put a bandage on it that doesn't stick, so that when you peel it off, you're not peeling the skin with it.
Yeah. All right. Good advice. All right. I appreciate it. And also, on the website, we're going to have do's and don'ts if you're thinking about getting some plastic surgery done. Dr. Orden has those for us. We'll have those on drphil.com immediately after the show. We'll be right back. Well, I want to talk about an exciting event that's coming up. For the first time ever, Susie Orman, Dr. Oz, and I are going to appear on one stage together in Ask Oprah's All-Stars. This is a 4-part, 2-hour special on OWN, the Oprah Winfrey Network. Now, Oprah's network launches on 1/1/11. And let me tell you, this is going to be exciting. I'm really involved in this network with Oprah, I'm proud to say. I'm doing a number of different projects with her, including Ask the All-Stars. I'm doing a series called Finding Sarah that deals with the Duchess of York, Sarah Ferguson. We've been doing something called Get Your Own Show to find the next talent that will have their own show on the Oprah Network. And you're going to be able to see the Dr. Phil show every night on the Oprah Network as well. So we're very excited about all of this that's coming up. So Ask Oprah All-Stars premieres on Sunday, January 2nd at 8 o'clock, 7 Central. Now, we're going to be answering your questions about relationships, health, your body, and finances. Now, our goal is to help people live their best life ever in 2011. And you can ask us anything. So go online now and send us your questions. You can go to the Oprah All-Stars page on Facebook, or you can go to drphil.com for a link to Oprah's All-Stars. Now, as for today, I want to thank all of my guests for being here, especially Dr. Travis Stork, Dr. Lisa Masterson, Dr. Andrew Orden, and a special thanks to Dr. Sears for his great tips as well. The doctor's new book, 5-Minute Health Fixes You Want on Your Kitchen Cabinet, so you can pick it up if something happens in your house. It's in bookstores now, and let me tell you, it just makes a great holiday gift. And everybody in the audience today is going home with a copy of this book. Thanks for being here. So long. Thanks, guys. Thanks, everybody. Thanks.
Today on Dr. Phil.
I'm going to be a bride.
She's ready for her wedding.
Donnie asked me over the phone to marry him.
But she hasn't seen the groom.
I never met him in person.
Has she been hooked by a catfish?
We have done the research. Donnie claimed to be staying at the hotel in Cairo. Have you ever talked to that hotel?
No, I haven't. Donnie is in the Air Force.
In the cavalry.
Yes.
Lieutenant Colonel, does the Air Force have cavalry?
Doesn't.
You've sent him a lot of money. These love letters, he plagiarized them.
Well, I did the same thing to him.
Yeah, but he didn't send you $50,000, did he?
Is this a love scam?
He hung up. He told me not to text him anymore.
Joy, can we try to call him? Donnie, this is Dr. Phil. Let's do it.
Have a good show, everybody. Here we go.
I hate to see people suffering, and you've hurt long enough.
Stand by, Dr. Phil.
I'm going to get you the help that you need.
In 5, 4,
This is going to be a changing day in your life.
Go, Dr. Phil. You a question. If someone asked you to marry him via text message, would you say yes and then give your social security number and driver's license information to his friend, a person you've never met? This is a real life story of my first guest, Joy. Take a look.
Donnie asked me over the phone to marry him. I said, yes, I will marry you. The military is saying if he proves he has family, then they'll let him go. That's why we got married. So his lawyer made up a fake marriage certificate and sent it to the military. I had to give him my social security number, my date of birth, and my driver's license. In order to release Donnie, they need to verify the marriage certificate. We did vows with each other, a text message. He would send them first, and then I would repeat them back to him. When I got married to him over the phone, that's a new beginning for both of our lives. Donnie is stuck in Egypt, and we are getting married here on October 4th, 2014. He has even given me a $3,000 limit on a wedding gown, and he asked me, is $20,000 enough to spend on a wedding? For around here, yes, that's plenty. I'm excited to be married again.
So how did this blushing bride-to-be meet the man of her dreams? Here's their love story.
I met Donnie on Facebook. There was just something about Donnie that made me want to be his friend. Donnie is a senior officer in the Air Force. Sometimes I can't understand him on the phone because he has a French accent. Donnie is from Alabama. I've never been this happy until I met him. When I first met Donnie, he was in Nigeria. He tried to come see me twice, and then I got the call from the doctor saying that he got shot. I was devastated. I was crying for 2 days. I talked to him maybe 2 weeks after he came out of the coma. Since I have known Donnie, he has been robbed, shot, tried to commit suicide, hospitalized, in a coma, and arrested. He asked me for money about a month after I met him. I am paying for Donnie's hotel stay, but it's $650 a month. I sent Donnie money for medical bills, hospital, flight, phone. I have probably sent about $35,000, but he promises he's paying me back. Donnie's in Cairo, Egypt right now. That is his last assignment. When he gets home, we will move to Alabama. We will be living in a beautiful home with a wait staff. We have a relationship. We are in love. I never actually met Donnie. I believe in my heart Donnie is real.
Okay, well, I'm glad to meet you.
I'm glad to meet you too.
Why did you fall for him? What was it about him?
I didn't get all the love and care from my soon-to-be ex-husband that he was giving me.
So he was filling a void.
There was a lot of things that he said to me that I needed to hear that my ex-husband never told me.
Yeah. For example?
Donnie said he would always make me happy, make me smile. When Donnie met me, he said I was the person he wanted to marry.
Well, you say when you met him, online.
I never met him in person.
Well, here's a little of his background. Here's what we know about him, what you've told us, and what we've been able to find from his writings to you. He's in the United States Air Force, Troop C, 1st Squadron, 32nd Cavalry Regiment, Task Force Bandits. Never married. His parents are deceased. He was stationed in Nigeria when he was shot and robbed. Okay, military refused to pay his medical expenses.
I don't know why they refused to pay it.
Yeah. Released from the hospital eventually and is living in Cairo in a hotel. Now, he said he tried to resign from the Air Force, but he was told no because he doesn't have a wife or family, so he's in for life.
Yes, he's in for life.
United States of America Air Force said,
Yes.
if you're not married, you're in for life,
Yes,
buddy.
the United States Air Force told him that.
On November 9th of 2013, y'all had a phone marriage. Do you consider yourself married now? And I know you haven't filled
In
out.
our eyes, we consider ourselves married by that text message.
Right. So he had this phone wedding, but he needs your financial help to get home. Do you make a lot of money?
I don't make a lot of money.
So what did Joy's friends and family think about her online boyfriend, who she has never met, but in her mind and his, apparently, they are committed to each other, a heart marriage. Plus, Joy went shopping for a wedding dress in preparation for her upcoming wedding. We'll see what happened during that visit when we come back.
I'm at a bridal shop. I need to get a wedding gown. I love it. I'm going to be a bride. Yeah, this is going to be me in a few months.
And later, I just know what you told us, and we added it up, and it gave us the grand total that you've sent him of $51,927.90.
The ways I've sent Donnie money was through Western Union, MoneyGram, and I buy those green dot money packs. Western Union stopped me for sending money because they said I was sending it too often. I do not believe he is scamming me.
Well, that was Joy talking about how she sends money to her fiancé, Donnie Four, a man she met online almost a year and a half ago, but has yet to meet in person. Now, Joy and Donnie have set their real wedding date for October 4th, 2014. And like any bride-to-be, Joy has been making plans. Donnie gave her a budget of $3,000 for her wedding dress, and she spent some time at Alfred Angelo Bridal Shop in Beverly Hills looking for the perfect dress for her special day. Take a look.
I'm at a bridal shop. I need to get a wedding gown, and I'm very excited, and I'm going in now.
What brings you in today?
I'm getting married in a few months, and I'm looking for a gown. This is the one that I like online. I picked as my favorite.
Awesome. Well, we'll definitely try that one on.
I like those, too.
Well, we can try that one, too. Well, let's get started, okay?
Okay. I love it. Putting the gown on makes it feel more real that I'm getting married soon. Donnie does not know I'm here trying on gowns. He thinks I'm waiting till he comes home to try on gowns. I'm gonna be a bride. I really love this one. Donnie would love it if it was blue on top, because that's Donnie's favorite color. Donnie wants you to show off my boobs. Yeah, this is gonna be me in a few months. This is the dress. This is the dress I'm getting married in.
So you liked it?
I love that dress.
When Joy decided to share her excitement about finding her wedding dress with her fiancé, Donnie, well, the call did not go well. Let's have a listen.
I'm asking him if I can call him. He's telling me to call him. Hello? Hi. I want to tell you why I went shopping. I was looking at wedding gowns, and I found one I like. I'm going to buy it. $1,500 it cost, okay? Babe, I'm at the shop now, and they want permission to use your voice. Dr. Phil show. Is it okay to use your voice? He hung up. He told me not to text him anymore.
Why do you think he hung up?
I don't know. He thinks I'm lying to him, and he thinks someone's trying to track him down. Oh, no. He's saying no to everything. He won't talk to me. He's thinking of killing himself. He's going back to work and leaving me. He's telling me I think he's a scammer and I don't believe him. He's not answering me anymore. No, he'll never forgive me.
So that call didn't go well.
No, that call didn't go well, no.
But I'm guessing y'all have made up.
Yeah, we made up. He was very happy I was looking at wedding dresses.
The problem was when you said Dr. Phil.
Yes, he was very upset about that.
So he knows who Dr. Phil is.
He knows who Dr. Phil is.
Yeah, because I'm on in Alabama.
I'm sure you are.
He doesn't really sound Alabama-like, though, does he?
He is not originally from this country.
Uh-huh.
He is from the UK. He came to this country as a kid with his parents and become a U.S. citizen. And he has a French accent because he spent a lot of time around French people and picked up that accent when he was in the military.
In the U.S. military?
In the U.S. military.
I read some of the emails that Donnie sent to Joy, and I found some very interesting things in those. We're going to talk about that when we come back. He went and cut and pasted this from a love letter site and sent it to you.
Well, I did the same thing to him.
Yeah, but he didn't send you $50,000, did he? And later, Donnie's cell phone is actually listed in your name.
My name?
Did you open a phone in his name?
No, I didn't.
He has opened up an account using your name because the phone number you're calling is you.
Donnie always makes me feel special. He writes me romantic emails twice a week. I fell in love with you and I'll never let you go. I love you more than anything. I just had to let you know. He said I was his dream woman to marry.
You see this box full of binders and this one down here? This is all of the research that we have done here to try to figure out why the military would do what they're doing, who this guy is for real, if it's who he says he is or not, to make sure that you're okay. Now, this first one has to do with money that you've sent to him. What we know is you met Donnie in November of 2012, right? And we know that in November and December, you sent him $3,430. What were you sending him money for right after you met him?
Could be medical bills.
From his being shot and robbed?
And they weren't feeding them over there either.
The United States Air Force was not feeding the troops.
Yes.
Then in January, February, You sent him $5,346.90. Then in April, May, you sent him $15,300. What do you reckon happened then?
His friend Fred,
What happened with Fred?
he got shot. Fred was in the same troop as him.
Same troop. I bet Obama's loving you because you're taking care of all of this military. Okay, August through December, 5,302. January, February, 8,749 for a total of 38,127. Okay, however, you also sent him your tax return. You also said you paid his hotel bills for 12 months. And we added it up, and it gave us a grand total that you've sent him of $51,927.90. So this would be a relevant fact in our decision. So I'm going to put this over here. I understood that he really had stolen your heart. I mean, y'all have talked through emails a lot, right?
Yeah, we talked a lot of emails.
Yeah. And in this one, for example, he says, Joy, you make me feel special, like I'm your one and only. You make me feel like I'm a star in the sky lighting up your life. You make me feel safe when I'm near you, wrapped up in your arms. But he's never been wrapped up in your arms, has he?
No, he hasn't.
Well, we did a lot of research on what he has had to say to you. But here's the problem. We took this exact email and we researched it on the internet, and there are websites out there that list scam emails and content. And look what we found. He says to you, you make me feel special like I'm your one and only. On this website, it says, you make me feel special like I'm your one and only. Coincidence, maybe. He says, you make me feel like I'm a star in the sky lighting up your life. That's kind of a unique way to say it, right? On this website, you make me feel like I'm a star in the sky lighting up your life. You make me feel safe when I'm near you, wrapped up in your arms. Over here, he says, you make me feel safe when I'm near you, wrapped up in your arms. He didn't write this. We found the very personal, romantic email he sent to you on his website. This is one email, but it's suspicious. He sent you another email. How was I to know that you were watching me sleep? I awoke to see you laying there, and just then you smiled and said hi, and that just melted me. I wish all of my heart that I could wake to your beautiful eyes for the rest of my life. When you read that, did you wonder what he was talking about? Because that had never happened?
Yes, I wondered what it meant.
Well, we went to this website. He says to you, how was I to know that you were watching me sleep? How was I to know that you were watching me sleep? I awoke to see you laying there, and just then you smiled and said hi. I awoke to see you laying there, and just then you smiled and said hi. He didn't write this. He went and cut and pasted this from a love letter site and sent it to you as though it was from him to you.
Well, I did the same thing to him.
Yeah, but he didn't send you $50,000, did he? Well, we got to put that over here because that's suspicious, right? Everyone you see in yellow is plagiarized. This guy hasn't written to you. You are in a cut and paste romance. We got to put these over here. Do you agree that that's suspicious?
My opinion, no.
Okay, no. Joy says Donnie Ford, who is currently stuck in a hotel in Cairo, Egypt, is a millionaire. who has a mansion with servants in Alabama. Now, we poked around. We did some sleuthing. We're going to reveal what we found out about that next.
It's 9 a.m. and we're in a very small town in Alabama looking for a Donnie Four. Is there a Donnie Four that lives here? Is this picture familiar to you at all?
Now, Donnie claims that he's stuck in Cairo, Egypt. All he wants to do, he says, is get home to his mansion in Alabama. The one he claims is equipped with a staff of servants. Well, you know what? We went to Alabama. We wanted to know what was really going on there. Here's what happened.
It's 9 a.m. and we're in a very small town in Alabama looking for a Donnie Four. We got a tip that there's an address around here that is linked to Donnie Four. So let's see, I think this may be it right here. Hi, hello, hi. My name is Mary Ann and I'm with the Dr. Phil Show. Is there a Donnie Four that lives here?
No, no.
Is there a Donnie at all that lives here?
My name is Donnie.
Your name is Donnie.
Right.
But it's not Donnie Four.
No.
This is a picture that we have of a Donnie Four. Is this picture familiar to you at all?
No, I've never seen this person before.
And you don't know anybody by the name of Joy?
No.
Doesn't ring a bell at all?
No, I've never spoken with anyone by that name.
And how long have you lived in this area or on this property?
Over 20 years.
Do you know of anybody who, with that last name Four, that lives close by in this community?
I really don't know any Fours. I tried someone at the post office area. They may know.
Thank you so much. I'm sorry to bother you.
Well, that's no problem.
I spoke with the postmaster. They do not recognize anybody who looks like this. So now I found a general store and I'm gonna head inside to see whether or not anybody recognizes Donnie's photo. We're in town looking for a person by the name of Donnie Four. Does this man look familiar at all to you?
No.
No, and how long have you been in town?
For about 8 years.
Well, thanks so much for your time.
All right,
I appreciate it. Thank you. So, Dr. Phil, we've spent all day in southern Alabama looking for a Donnie Four. There is no Donnie Four here. Donnie said he lives in a mansion with servants in Alabama. There are no mansions around here. Our search has turned up empty.
We have searched tax records, phone records, utility records, everything there could possibly be. There is not now, nor has there been in the past, a Donnie Four ever lived there at all. And the thing that concerns me is, you know, he says he's a millionaire. He claims he has a mansion. He claims he has servants. This is apparently an address that this person has used. This is it. This is the address. It's about a little over 2,000 square feet. I mean, if you got a maid and a butler, they're on a cot in your bedroom. There's no mansion in this city or around it, and we check all of the records. It not only does not live there now, there's never been anybody that's ever lived there by that name.
Have you checked his military record?
Oh, yes. We checked, we got a private investigator. Now, not just our producers, we got a private investigator here. And I want to share with you the findings that we have on this individual. Here's what we found out. Donnie's cell phone is actually listed in your name.
My name?
Did you open a phone in his name?
No, I didn't.
Okay, then what he has done is he has used your personal information and he has gone and opened up an account using your name because the phone number you're calling is you. Now, Donnie claimed to be staying at the hotel in Cairo. Have you ever talked to that hotel?
No, I haven't.
Why not?
So I don't have the number.
And this lawyer, this barrister, David Cohen, he says, thanks for getting back to me. I have all what you send to me, and I will start the processing by Monday because it already weekend, and I have a lot of work in court this week,
And by God's grace, I will get back to you next week. I'd get me a new lawyer. that boy can't write. So his involvement was to create a false marriage certificate so Donnie could get out of the military, because you don't get out unless you're married.
Correct.
Well, we tracked down the real barrister David Cohen, who is an immigration attorney in Montreal, Canada. And he's joining us on Polycom now. Sir, thank you so much for joining us.
It's my pleasure. I hope I can help out.
Well, I hope so too. Let's just get straight to it. Do you represent someone by the name of Donnie Fore?
Dr. Phil, I've done a thorough verification of all of our records. And not only do I not represent Mr. Donnie Fore, we never had a client with that name or actually anything close to that name.
Right. And did you ever agree to create a false marriage certificate to get someone out of the military?
No, I absolutely did not.
David, let me again say to everyone, if you see the name Barrister David Cohen associated with something that looks fishy or some scam, it is not this David Cohen. He has had his name misappropriated. He is a lawyer of the highest reputation, been practicing for over 30 years. So just know this guy's on the right side of this, not the wrong side. And I thank you so much for coming on and helping this lady. All right, we're going to have to take a break. I'd like to speak to Donnie myself. I want to hear his voice. We're going to call him when we get back. Do you have your phone?
Yes, I do.
Can you dial it? See if you can get the boy on the phone. You asked me earlier, did we look at his military record? The answer is yes. Donnie has made several claims about issues he's having with the United States Air Force. So joining us to address these claims is retired Air Force Lieutenant Colonel Bill Ajax Paris. Lieutenant Colonel, thank you so much for being here.
Thank you, my pleasure.
Let's just talk about this. Donnie claims that he's in the Air Force, Troop C, 1st Squadron, 32, the 32nd Cavalry Regiment, Task Force Bandits. Does the Air Force have cavalry?
No, sir. None of those names, except the word squadron, appear in any Air Force designation. That is not an Air Force unit, and no one who knows anything about the Air Force would claim that that was an Air Force unit.
That's a lie.
I don't know anything about military.
No, he does. See, this guy right here, this is Lieutenant Colonel Paris right here. How many years are you in the military?
21 years.
21 years in the Air Force, right? If you're in the military and you get shot down on the street, do they just step over you and tell you you're on your own?
Absolutely not.
I know we've had budget cuts, but come on.
Absolutely not. The Air Force and all the services take excellent care of their troops in any medical situation, whether it was in combat or whether he was a victim of a crime. It doesn't matter. He will get medical care.
Okay, then he said that he's told since he has no wife or family that he was in the Air Force for life and cannot resign.
Yes, that is what he told me.
You married?
No.
How the hell did you get out?
I served my time.
You served your time?
Yes. There is no such thing as in the Air Force for life, period.
Better put those over here then. Now, we also had his voice analyzed. We had a linguistics expert listen to this, Dr. Alan Perlman, and he is not Hispanic, African, or European, definitely not a native speaker of American English, probably South Asian, Pakistani, Indian, or Bangladeshi.
Do you think those pictures might not be his?
Yeah, let me be real clear about that. There is absolutely no evidence whatsoever that this man is named Donnie Ford, and there's absolutely no evidence whatsoever that he is in any way associated with this scam. Like Barrister David Cohen, someone has stolen his image off the internet, stolen his picture, and decided to use it, is what it would appear. We are showing these pictures knowing that the man in these photographs is not a scammer. We can add the voice analysis to this pile, can we not? So that's all the evidence that suggests that this is not what it appears to be. Here's all the evidence that he is who he says he is.
Nothing.
There's nothing over here. Tell me what you think, feel, and believe at this point.
That he isn't who he is.
How do you feel about that?
I feel very upset and embarrassed.
But you would rather know than not know.
Yes, so glad I came.
I'd like to talk to Donnie. So, Joy, can we try to call him? Do you have your phone?
Yes, I do.
Oh, can you dial it? See if you can get the boy on the phone. If he answers, I'll let you speak to him.
Okay.
Please leave your message after the tone.
Hey, Donnie, this is Dr. Phil, and I'm here with Joy, and I would really like to talk to you because I'd like to share with you that there have been some real advances in tracking IP addresses down and locating users of that sort of thing. You know, in case you run into some chicken scumbag that's ripping money off of people. And so, given that that can happen, myself and some of my associates in the Cyber Crimes Division here in LA would love to chat with you. You have a nice day. All right, we have to take a break. A former guest who sent over $63,000 to a man she never met, well, she's back. Sandy's online boyfriend, Max Moose Advisor, claimed to also have been in the military but unable to see her because he was stuck, this time, in Afghanistan. She has a message for this very, very nice lady right here when we come back.
I've sent cash to Max in cereal boxes.
You have $25,000 in cash you're putting in a cornflakes box and shipping to Ghana.
If not for Dr. Phil, I would probably be destitute.
Sandy is a former guest who sadly relates to Joy's online relationship experience all too well. Take a look at what happened when Sandy last appeared on the show, and also there's a surprising update.
When I met Max, he was in Afghanistan with the UN peacekeeping forces on a top secret mission. Every time we try to meet, there's always a problem. I've sent cash to Max in cereal boxes.
What did you say to yourself? You're standing in the kitchen, you have $25,000 in cash, you're putting in a cornflakes box and shipping to Ghana.
He had told me that his name was Max Moose Advisor. I thought it was very strange.
We cannot find one record of one human being in the history of the United States whose last name was Advisor.
By being on the show, I discovered that I was being scammed by someone in Ghana. I was very sad that this person wasn't who I thought he was. If not for Dr. Phil, I would probably be destitute. Since appearing on the show, I met a really nice gentleman who actually lives across the street from me. Dr. Phil told me to keep my eyes open to love, and I did.
If you're chasing this relationship, you're going to miss the guy at the grocery store or at your church or around the corner.
There is a happy life on the other side once you work through this.
Okay, well, Sandy, I'm so glad to see you and with a smile on your face.
Thank you, Dr. Phil. It's good to be here again. My heart goes out to Joy. I know exactly where she is right now, how she's feeling. But I want her to know that there really is life after this. You've just got to realize that Dr. Phil's right, and this guy doesn't exist. He's not who he said he is.
Is there any doubt in your mind?
It's not real. It's done.
You totally get it.
Yes, I get it.
Look, I want Joy to know there are people on her side, her friends at home who wrote into the show, and Joy's mother, Joyce. She's been listening and is joining us on the phone right now. Joyce, are you there?
Yes.
Do you believe he's real, or do you believe he's not real?
I believe he's not real, but if I find him, he's going to be gone.
Well, I certainly cannot advocate vigilante violence, so you just have to make up your own mind.
You won't know when it happens, honey.
I got you. I got you. Now, please meet Dr. Julie Albright. She is a digital sociologist who has studied this phenomenon of online relationships and scams. Doctor, thank you so much for being here. This is rampant, right?
It is rampant. It's changing its character, though. Obviously, deception's gone on online for a long time, but it used to be people just wanted to maybe hook up. An overweight woman would send an old photo 100 pounds ago, hoping that the guy would fall in love with their inner self. So that kind of thing went on. Or a guy would say he was single when he's married. That's the most common one. But in recent years, it's taken a sinister turn, and that's where you're seeing this. This is of a criminal nature.
You use the term sometimes called spearfishing. Talk about that.
Yeah, the idea of spearfishing, oftentimes this is a corporate espionage type of thing, cybercrime, where they're trying to get information, they're trying to get passwords. But this is a new kind of spearfishing. I see it that way, where they're actually targeting, possibly lonely women, women that are more vulnerable. Maybe they've gone through relationship troubles, and they'll target them to get money. It isn't about getting a relationship, which is what it was about before. Now it's about finances.
Yeah. Look, the thing I want you to understand is this. This is a whole process. You went through a marriage that left you more than unsatisfied. It made you vulnerable to this kind of thing, and because you had needs and you wanted them to be met. And you do have needs, but there's a healthy way to meet those. And I want you to let me help you by getting you some professional help back at home that will sit down and help unravel all of this for you, help you get a grip on it. I don't want you leaving here feeling like, well, okay, now I got nothing. That is absolutely not true. Let's work through this and be better for it. Okay? Will you let me do that?
Yes.
Okay, we'll be right back.
Coming up, what's getting the audience this excited? You'll find out next.
Well, as you know, my wife Robin loves to give back. On Fridays, Robin is going to be sharing with you some of her favorite things. Now, the first item that I just really don't know much about, so you're going to have to do this one.
Well, it's the T3 Featherweight 2 Blow Dryer. And I am so excited to introduce to you this blow dryer because it is clinically proven to be healthier than air drying your hair. And it dries your hair fast and with results that really, really last. It increases body, shine, combability, and style retention. And I really love this blow dryer so much that I'm sending the entire audience home a blow dryer.
And if anybody wants to, you can have mine.
Okay. Sometimes I just don't have the time or energy to do my own hair. So I've teamed up with Blow, North America's original blow dry bar. Blow is a quick and convenient solution to getting your hair done, and they are open 7 days a week. They only charge $40 for a wash and a blowout, so no matter your hair type or length. They are the largest blow dry bar chain in the world, and everyone should experience this affordable luxury. So I'm sending the whole audience home with a free blowout from Blow. I'm so excited because I'm also sending the entire audience home with a 30-day skincare kit from my new skincare line, Revelation. And proud to say that to help celebrate the launch of my new skincare line, I have created a lip gloss collection called Avery Lasting Love, named after our granddaughter Avery. And everyone in the audience is going home with a lip gloss from the Avery Lip Gloss Collection.
So they all get one. All right. I also want to point out that 100% of the net profits from Robin's lip gloss line are being donated to Robin's Foundation When Georgia Smiled and will directly help women and children affected by domestic violence. So to learn more, log on to RobinMcGrawRevelation.com. I want to thank all of my guests today. We'll see you next time.
Today on an all-new Dr. Phil.
Women are better at breakups, better drivers, and maybe a little brighter.
Are women better than men?
Who tolerates pain better?
At just about everything.
Men get hit by lightning more than women.
So we are number one at something.
The surprising results.
I'm the better driver.
You test your driving skills around a tree.
Just in case NASCAR calls, you'll be ready?
This is going to be a changing day in your life.
Have a good show, everybody. Here we go.
It matters to you. That's what I want to talk about. Are we ready in the booth? Let's do it. Now, you've all heard the saying, anything men can do, women can do better, right? Well, that's what we're talking about today, actually. We have split our audience. Women on one side, let me hear it from you guys, and men on the other. We're going to be talking about driving to cooking to tolerating pain. There are those who say women do it better. In fact, some research says women even have better memories. So we asked comedian Kate Rigg to put that theory to the test this morning with our audience. Take a look at what happened.
Okay, we're here with Derek and Melanie. I'm going to show you a few objects, and we're going to see which one of you remembers them better. Okay, you got 10 seconds. 6, 7, 8, 9, 10. Okay. What is in the bottom right-hand corner?
I don't know.
There are 2 black and white objects. What are they?
One was a cat. I don't remember the other.
What color's the pen?
I don't remember.
One object is green. What is it? Check mark. It's in the bottom right-hand corner. Magnifying glass. Blue. Chocolate. She got everything right. Everything. Yay! One object is green. What is it?
The pen.
Check mark. Correct. What is in the bottom right-hand corner?
A basketball.
Magnifying glass. What flavor is the cake?
Vanilla.
Chocolate. What's in the center of the picture?
Oh.
There's a heart. How many objects are there? 8.
10.
What color is the pen?
Green.
Everything was wrong. One object is green. What is it?
Check mark.
What color is the pen?
Blue and black. Chocolate. Black. Red.
What is the name of the cat?
Mishka.
He got everything right. He even knew the cat's name. But that's because they're not married yet. That's why.
That's true.
Yeah.
After marriage, you don't remember anything.
You won't remember anything.
Well, some of you already met comedian Kate Rigg this morning, so welcome, Kate. Thanks for being here. Now, my good friend Dan Abrams is also here to talk about his new book, Man Down. He says women are better than men at just about everything, including memory. What are you, a turncoat or something?
Yeah, I know.
What is up with this?
You know, I looked at it like a lawyer, and I looked at the evidence. Study after study shows that women have better memories.
All right, well, Corey, you and Megan stand up. Okay, now, Corey, how many did you get right?
I think I just got one right.
I don't think you got any right. I guess you don't remember.
I guess not.
And Megan, how many did you get right?
I got them all right.
You got them all right.
Yeah.
So you're kidding. So, James, where are you and Ashley? You actually got everything right, true?
True.
It's the only guy out of all of you that took this that got them all right. Okay, now, are you surprised that you got them all right?
Yep.
Work with me here, will you? Come on. I need some arrogance. Sit down. You guys sit down. Okay. Are women really better than men at almost everything? We sent one man and one woman to do battle on the streets. Take a look.
Hey, it's me, Kathleen Madigan. I'm at the farmer's market, and we're going to talk to people about claims women are better at many, many things.
My name is Kirk Fox. Here's what I know. It's not fair, and I'm going to prove it.
I don't even think the questions are necessary.
I'm going to talk to people, and I'm going to find out the truth.
Who do you think is better at driving?
I'm going to go with the men.
Really?
Yes.
Women, of course. Girls are just better at everything.
Why do you think then all of NASCAR is men?
That's just going around a circle on a track. That's not driving in and out of traffic.
They do say that women are better drivers than men.
No, not at all. Women drive with their eyes closed. No.
You ever seen a girl reverse park? No, I've never seen a girl reverse park because I don't think they can, correct? There you go. Are you a good driver?
Yeah, I think I'm a good driver.
Now, you made a face when she said she's a good driver, so she's a bad driver.
She's a scary driver.
Who do you think is better at giving and getting directions, men or women?
Women. 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 Men don't ask.
If you got lost, would you stop and ask?
Yes, I would stop and probably ask a man.
Even if you got yourself lost and you're a guy, I need to double down on stupid?
You think women across the board are better than men?
I have to say, some of the best bosses I've ever worked for have been women.
Clearly, she's wearing the pants in this family, even though they're a little short, but that's because it rains a lot in Seattle.
Is there anything else you can think of that women are better than men?
Cooking, cleaning.
What are you, from a time capsule?
No, women take less time to get dressed than men.
No, I've got a house full of 3 girls, so I definitely deny that.
Who do you think's more likely to get struck by lightning, a man or a woman?
I actually knew a woman who got struck by lightning, and she had one big problem that she wouldn't have had if she were a man.
What was that?
Underwire.
Wow, in the bra.
Yeah.
Okay, after being out here all day, I do think that women are just better and maybe a little brighter, but apparently the men don't care. So that's the good news.
Well, my street warriors are here. Comedian and actor Kirk Fox is here, and comedian Kathleen Madigan. The book we're talking about is Dan Abrams' book, Man Down. I'm going to read the rest of this title. Proof beyond a reasonable doubt that women are better cops, drivers, gamblers, spies, world leaders, beer tasters, hedge fund managers, and just about everything else.
That's the book.
I just don't get it.
It's my new favorite book.
Yeah, I suspect so. So, what do you think, Kirk?
Well, I burnt mine after I read it.
Did you?
I just feel that the women didn't need any more ammunition against us.
Yeah.
And that's what this book has, is the ammo.
Yeah,
it's got the
it is
research
the
and the
ammo.
studies right there.
So why are women better? Because you really believe that.
Well, some of it. The driving thing, I can't. I mean, for me to ride in a car with my mother, I literally have to have a bag over my head, an iPhone. I can't. She's horrific. I mean, 2 years ago, she stopped making left turns. Period. She ruled it out. And then she said, UPS doesn't either. There's facts backing it, Kathleen. Don't make left turns. How do you not do that your entire life? I don't agree with the driving. Some of it, the memory, of course. I mean, women, yeah. I don't even know why men bother to fight with us.
But why are women better
It's
memory?
ridiculous. I have files from 1974 I can pull out on your ass. You won't even know what happened.
We decide what we want to remember. That's all there is to it.
But that's nothing. That's only 3 things.
Sometimes you don't want to remember everything.
But on the driving one, why would the insurance companies, on average, charge 7% less for women than for men?
Because it may mean we have less accidents, but it doesn't mean we're better.
It's profiling is what that is.
No question about it.
Do you think women are better drivers?
You know, I think all women except for my mom are better drivers. She's looking over her shoulder yelling at me, why aren't you in medical school, and not looking at the road?
You say that 77% more men.
70%.
77%.
See, you didn't even remember that.
Do you see this? They're already keep jumping on me. Yeah, stick with me. Occasionally stick with me. You say 77% more men die in traffic fatality at the wheel. But you do not mention that 90% of the accidents are caused by women that men die in.
I don't think you're getting it.
Stick with me, guys.
Okay, Kirk, I got crickets over here. I got crickets over here. All right, we're going to be asking all of you in the audience for your opinions throughout the show. And you'll all be voting with your Paget gadgets, so get them ready. Dan says women tolerate pain better than men. We're going to talk about that next. But first, I want to know what you think. Ladies first. Who tolerates pain better, men or women? Press 1 for men and 2 for women. Now, it's only the women voting now.
Don't forget, guys, don't vote. What was the question? They're like, what was the question? Say something about
we don't stand a chance.
All right, let's look at the results. Women say 85%. You really think you're better with pain than men? All right, men, it's your turn. Get your Paget gadgets ready. Who do you think tolerates pain better, men or women? Press 1 for men, 2 for women.
Think about childbirth while you're doing it.
This is not an essay. Mr. Lawyer's making the closing argument up here. Are you kidding me? All right, let's see the results. All right. Men say 75% men. All right. Next, I'm putting one man to the pain test. Kirk Fox, I'm looking at you. We'll be right back.
They say that a woman is better with a hammer. Do you believe that?
Not at all. I'm very good with a hammer. I hit my thumb every single time.
You show a lot of pain because he says that women tolerate pain more.
They definitely tolerate pain more. My wife just gave birth. I couldn't handle that kind of pain.
Tomorrow on an all-new Dr. Phil. Both of these women
You made a choice between having this child and keeping your boyfriend.
have a secret regret.
I regret that you're my dad.
She never knew her father.
Are you sorry she contacted you? I knew the day was going to come.
Now, all her questions
Why in 20 years have you not reached out to her?
will be answered.
You have said, I truly believe that Kelsey isn't mine.
That's tomorrow.
Joining us now is our GMA legal analyst, Dan Abrams.
Two key things we're seeing here. Number one, the defense is going to go for evidence tampering, and number two, the cause of death. Meaning, how do we know that she was actually killed, they'll argue. Those are going to be, I think, some of the key points to the defense.
If the authorities have the right person here, this was classic police work. To look at the security cameras, to talk to the neighbors, to examine the footprints, to look at the types of wounds, etc. They start to say, you know what? This just doesn't add up.
Well, that was Dan Abrams in his new role as legal analyst for ABC's Good Morning America. Now, he's also the author of Man Down. I would not have expected this from you, Dan. He's joined by comedians Kate Rigg, Kathleen Madigan, and Kirk Fox.
Honestly,
you read some research that got you
look,
onto
this book was in a way an accident, which is that I happened to come across the.
It was an accident.
Bad accident. I came by a dude. I came. Look, the truth is though that this book is more credible, I think, coming from a man. I think if a woman had written this book, some guys would just say, "Yeah, of course."
Did a woman force you to write this?
No one forced me to write this.
Well, did a woman help? How did you remember all this? Did you have a did you have a female editor?
I had a female researcher and I had a female editor, and they were both very helpful in the process.
Will you agree that most of your surveys were done in foreign countries that we can't research?
Some of the studies were from foreign countries.
Estonia, does that even exist?
There was one study from Albania. But it was, but nevertheless,
I rest my case. This is America.
It was
He's right about America
study.
too, though. There are some uniquely painful experiences that women say they endure, such as childbirth being the obvious, right? But then there's something else that I've never gotten, and that's waxing. Okay? I don't get what is up with waxing. First you get burned, then you get ripped. Now, since Kirk thinks anything a woman can do, he can at least do. So I thought I would volunteer
volunteer him to see how he holds up to some hot wax. Do you want a leg?
I want a leg.
Or a wing? What do you want a leg?
The left leg.
My left leg is my better side.
Underarm might be good.
Okay, underarm. Can we have your leg up here, please? You'll do anything for your art, right? For your craft?
That was my father's sock, if anyone's interested.
Yeah, that sock doesn't even almost match anything you're wearing.
It doesn't matter.
No.
So I guess
But I dressed quick. I was done before them.
You say men take longer to get ready than women. That's what I didn't get.
So there was a 2,000-person study done in England, and on average, the men took 83 minutes, and on average, the women took 79 minutes.
Now, I don't get it.
Look,
I have never
let me tell you something.
I have never spent 83 minutes getting ready for anything. So how long does it take me to get ready? I mean, because seriously, I get in the shower, I get out, I shake like a dog to get the water off of me. I get dressed and go, right?
Well, you don't have to do your hair, so that cuts a lot of time.
Now that was cheap.
It's true, though. Sad but true.
Dr. Phil, you see how they are? They attack. I will say that wax is a little hot.
You pay people to do this.
All over our bodies. I do pay. Yes, yes.
Now, will this make me a better swimmer?
Yes.
Yes.
Will I swim in circles? Maybe you should do both legs.
It's happening. It's happening. It's happening.
Okay, now Kathleen is going to tear this off.
Everyone look away.
Can you do it real slow?
No, that will hurt more. You ready?
I'm at peace.
You ready?
The other way.
I'm going this way.
Yeah, that
ready?
Well, don't go up too high.
All right. Do you want a countdown, or do you want me to
All
shock
right, we
you?
got to count down from 3. 3.
Can I take this home?
Oh, that is so nasty.
Nobody wants that.
My mustache doesn't even like to see that.
That is wrong
Yeah,
at
let's
so
do the
many
mustache.
levels. That is wrong at so many levels. All right, we have one more way to test pain tolerance of men and women, and that's ice water. So bring out the ice. Okay?
He's still in pain. Look at him.
Most of it's mental.
This is like a Japanese game show. Come
All right,
on,
we're gonna put Dan and Kate to the test.
Okay.
So you got to put your hand in the ice water.
Can we put my leg in there first?
And we're going to see who can hold it in there the longest. All right, 1, 2, 3.
I don't care what it takes, Kate. I'm going to win. I don't care if your hand falls off,
worry.
Kate. We are here to prove
Dr.
your
Phil,
point.
anyone tuning in now, they'll just think I'm lazy with my leg up.
Look at it. She's not even sweating.
Yeah,
and you
no,
look like
It hurts a lot.
It's not good. Yeah.
Does that hurt?
Kate, keep the Asian
It hurts. Yeah.
Come on, you can do this.
It hurts more than I thought it was going to hurt.
Hurts a lot.
Ow. It hurts a lot more than I
Does
thought
it bother you?
Ow.
It hurts, but I'm not going to lose.
I'll even drink. I'll hold his hand in if I have to.
Yeah.
I'll hold her hand.
I'll drink that afterwards.
Look at
Seriously, dude.
Look at him. He is white-knuckled on the chair, and she's looking at her nails over here.
Kate's feet aren't moving.
Yeah, no, I'm admitting I'm in significant pain.
Dan, you look like you are hurting.
Yeah, no,
Tough it out for us.
I'm just going to wait.
Kate.
I'm hoping that my hand is just going to get numb.
Yeah, I don't think
pain,
she's going to quit.
Yeah, I don't think so either.
Hopefully you won't be able to write another book.
Yeah. You know, it feels better than it did about 30 seconds ago. Yeah. I get the
That's
feeling.
called frostbite.
Yeah, I get it. Yeah.
All right.
I'm going to give it another minute.
No, you're not.
We're going to watch this during the break. Next, a man who has spent his entire life surrounded by nothing but women. He's also the genius behind some of the world's biggest hits. We're watching the ice. We'll be right back. We've been talking to author Dan Abrams and comedians Kirk Fox, Kate Rigg, and Kathleen Madigan about Dan's new book, Man Down. Now, they are in an ice test here for pain.
Rate your pain.
It was at about 8.5. It's now gone down to about. I think that I'm now enduring some level of frostbite.
Okay, and where would you put it? He was 8.5.
Mine's high. Mine's like a 9.5, but I'm not going to lose.
All right, I'm going to declare this a tie so you don't get frostbite. You can pull your hands.
Oh, yeah.
My next guest knows women better than just about anyone. He is a good friend of mine. He has got 6 sisters. He's got 5 daughters. You know him as the Hitman, and he's back for round 2. Take a look.
The Hitman himself, David Foster.
Woo! What a night!
When we had done The Hitman, the response was so great, it exceeded, I think, everyone's expectations. For the second Hitman, I had to dig a little deeper. When people see the final show, I think they're going to be thrilled. I know I am.
All right, please welcome legendary music producer David Foster and his fiancée, Yolanda Hadid. All right. You have women all around you.
I do.
You have 6 sisters?
I have 6 sisters, 5 daughters, 3 ex-wives, a new one coming, hopefully not an ex.
No, there's not a new ex
2 stepdaughters, a very strong mother. I know one thing for sure, 100% without a shadow of a doubt. Women are smarter than men. Period.
Why do you say that?
There's more to it than that. Women are more manipulative than men. Men are dogs, women are cats, okay? Basically, men are dogs. You just feed us, get us you say that on the show.
Well, you did.
And scratch our belly, and we're good to go. Women are like cats. You rub their fur the wrong way, they go crazy. They don't come when they're called. They got claws. It's like, you know.
Gotta give him catnip.
How do you put up with this?
He's just goofing off.
We are very, very compatible, Yolanda and I, because she's a detail freak as well, and we're very complimentary. And Yolanda is a very strong woman, but she has made a pledge, and it's just her nature, she's European, that in the house, the man is king, and that works for me.
Yeah.
Right?
I'd like to move in there as well.
What was it like growing up with 6 sisters?
Well, it was great, and honestly, I was always made to feel special. My sisters, I have a great family. All 6 of my sisters are incredible. They treat me well. They always treated me like a king, and I was like the golden boy in the household. I mean, who wouldn't like that?
And 5 daughters.
5 daughters is a different story. You know, I've been where, if you have young children, my children are all grown now. I've been where you're going. It's not pretty, but you do get there. And my daughters are great, but not without a little, you know.
So how's he do with your daughters?
He's incredible. He's incredible. That's why I want to marry him, because he's so good with my children.
Yeah.
I mean, that's
important.
That's very important.
Right.
I don't think
but
it wouldn't work any other way.
We should explain. You should explain about the king thing in the house. I mean, you have that all organized in your brain.
He keeps wanting to go back to the king thing in the house.
Right.
You love it, don't you?
But you do it in a very loving way. It's like
no. I mean, for me, you know, I don't think. With the question about a man smarter than women, I don't think so. You know, I think we're all equal. But like in our relationship in the house, for me, my man is king, and he loves that. But maybe it's a European thing, or it's just the way I, you know, feel is great for our relationship.
Oh, it makes sense to me. I think it's...
Or depending on what kind of king you are, what are your demands? I mean, if you're Saddam Hussein, I'm not into it. Yeah. You know what I mean, but if you're a nice king,
if you're the king,
maybe
he's a good king.
Are you king of your household, Phil? Robin?
Am I?
Yeah.
Oh, yes.
Until he comes home.
Well, no, actually...
Yes.
Actually, we kind of have a division of labor, and I guess I'm kind of old-fashioned in this, that I think that the home is her domain, because she loves that, right. And she designs, and she decorates, and she fixes, and I enjoy.
Yeah.
All right, Dan's book also showed evidence that women are better drivers than men. So we asked our viewers to take a poll at drphil.com. The question we asked was, who makes better drivers, men or women?
And here are the results. 57% said women are better drivers, and 43% said men are better drivers.
This one is not debatable, all right? The bottom line is that men get in more accidents, they drunk drive more often, they die more at the wheel, and their insurance rates are higher as a result of it. I mean, that's just a fact.
That's because they forgot they were drunk when they got in the car to drive home.
So we are number one at something.
God, there's nowhere to run. All right, next, one young couple fighting over the driver's seat. We'll be right back.
So my fiance thinks he's a better driver than me. Baby, I'm sorry, but I'm a much better driver than you.
Just doesn't have the right driving method.
Who do you think is more likely to get struck by lightning, a man or a woman?
Oh, for sure, a man.
Why are you saying a man?
I don't know. They're just idiots sometimes and tend to get caught in the rain when they shouldn't be.
Who do you think is better at handling a breakup?
For sure, the guy.
I would say guys, too.
Wrong. Really?
Women.
Wow.
Yeah. Why do you think the guys?
It's like Tarzan and Jane. Tarzan's the guy who always gets the food, man. Jane was sitting back smoking grapes.
Well, that was reaction to Dan Abrams' new book, which is called Man Down. Now, Dan says women are better than men at most things, including breakups. Now, we've been talking to Dan Abrams, David Foster, his fiancée Yolanda, and comedians Kurt Fox, Kate Rigg, and Kathleen Madigan. Now, Tony, what do you think? You say men are just better at driving because what?
Well, me personally, you know, I think we just pay attention more. I mean, most of the time, guys are, you know, on the road a lot more because of different fields, driving trucks and,
all right,
you know, that kind of thing.
Now let's talk about breakups. Men are better at breakups?
I believe so, because we're stronger emotionally.
Oh, my gosh.
He's right.
Because men are stronger emotionally.
Yeah, I think so. I mean, I think men are built to be strong. They're built to handle many different types of situations. So you can move on a lot faster, I feel like, than a woman can.
Now, the research just doesn't support that.
That's right. And there's a specific reason for it, which is that when a couple gets together, a man tends to forget about his friends. And he tends to turn to that partner as his number one person. And women keep their circle of friends. And so when a breakup starts to occur, women have this group of people to turn to talk to about what they're going through, while men do not. And that makes it harder for men to endure a breakup than for women.
What do you think? You said men are better at breakups.
Well, I think that because I do tend to agree with that, you know, females tend to get more emotionally involved in the relationship. So I think women are better at breakups, but I think it's, you know, because we tend to put other people first as opposed to a man tends to think of only himself.
Let me ask you guys something. Do you think it's easier being a man or would it be easier being a woman?
I think it's easier being a man.
Why?
I just think that women have more hurdles to overcome. I mean, you see, look, one of the reasons that the book shows that women endure pain more is because they suffer more pain throughout their lifetimes. And as a result, they can endure pain more. And I think that that's just a reality.
What do you think?
And it's tough to be a woman. Well, it's a man's world. I think that still applies. The hunting and gathering, I mean, I know it's been millions of years. It's been around for millions of years for a reason. That's the way it should work.
Do y'all think it's easier being a woman or being a man?
Being a man. I mean, look at them. There's not a lot going on.
I love being a woman.
Listen,
I mean,
he's a woman until I got waxed.
He's still thinking about the waxing. He hasn't heard anything since.
I just know I'm not balanced right now.
He's drifting out. There's tears in his eyes.
But we love being a woman. Everything we're doing.
But see, you guys are harder on each other.
Not really. We
no,
do.
Women are harder on each other. You do things that men don't do. You never see a man walk up with a new haircut to his buddies and say, notice anything different? You never see that.
Dr. Phil, I've done that.
No, you never see that.
But you guys don't think about any of that. You know, we are much more...
That's why it's easier, because you don't think about it.
Exactly.
Well, I know, but we can go see each other. We don't have to bring a little gift when we stop by. You guys make it harder.
Think about anything. My father's had the same haircut since he was 4, and he's like, I found a good one and I kept it. I mean, that's all the thoughts. He's never going to get another haircut. It's just that simple.
We talk about when Phil and I go out to dinner. What do you think we talk about?
Nothing. Food. Work. Work. Do you talk about work?
You part.
Do not tell them what we talk about.
I know.
I wasn't going to get the answer.
Okay, do women make better drivers? My next guests are on opposite sides of the road on this one. Take a look.
So my fiance thinks he's a better driver than me. He dogs his cars, sends donuts in the yard. He acts foolish.
How can Nicole possibly think she's a better driver than me? She drives slow, like a grandma. She just doesn't have the right driving method.
Baby, I'm sorry, but I'm a much better driver than you.
She takes forever to stop, and when she does stop, all she does is punch the gas and make me fly back in my seat holding on for my life.
Tickets, wrecks, and my fiance thinks he's a better driver than me? I don't think so.
I'll admit, I've had more traffic tickets than her, but I've only had 4. Everybody's had a traffic ticket. Come on. I'm the better driver.
All right, Justin, do you feel safe with her?
No, sir.
Because you look scared when you were talking about that.
Oh, I'm scared.
So, are you reckless?
No, he's reckless.
Really?
He speeds, texts, and he doesn't pay attention. I'm very cautious.
Oh, throwing you under the bus here. You don't text and drive, do you?
Occasionally.
No, you don't want to do that. You don't want to do that. You need to stop that. She ratted you out.
Yeah, I know.
I want you to go sit on that side now.
Yeah, that's not good. Do you feel safe with him driving?
Sometimes until he wants to play.
Yeah. What's up with driving around a tree?
Oh, I just like to test my driving skills.
You test your driving skills around a tree.
Yes, sir.
Just in case NASCAR calls and they're like, oh my God, we don't have a driver this weekend. You'll be ready? Who would do that? Really?
This is the reason men get hit by lightning more than women as well. It is. Why do men get hit? Why are 82% of lightning strikes on men rather than women? Because the man wants to either go play that extra round of golf, even though there's a thunderstorm coming, or he wants to fix that thing on the roof, even though he knows that there's a big storm. Men are more reckless. That's the bottom line.
So why?
And this applies to driving as well.
If women are so much better, why are all the NASCAR drivers men?
Look at Danica Patrick. I mean, she's an incredible driver, but not a lot of women maybe get the opportunity to participate.
Or not a lot of women would have the desire to drive in a circle 250 times. I would like to actually do that somewhere. Why don't we drive from Denver to Phoenix, honey? Wouldn't that be something instead of a circle?
According to Dan's book, Man Down, women also make better police officers. We're going to talk about that next. But first, get your Paget gadgets ready. Who makes a better police officer, men or women? Press 1 for men and 2 for women. All right, let's see the results. Oh, 75% say men, 25% women. Your book says different.
Right.
But next, we're going to talk to a former female highway patrol officer. You might be surprised what she has to say.
Over the years that I've been driving, I've been pulled over a number of times. I have noticed a definite pattern that I can say I've experienced with 100% accuracy. All the male officers that have pulled me over have let me off with a warning, whereas all of the women officers have given me tickets. That's my experience. The female cops are always the ones that give me tickets. So, are women better at being patrol officers than men? I don't know, but I personally would rather they not.
Well, in his new book, Man Down, Dan Abrams says women are better at being police officers. Now, we're also joined by David Foster, his fiancée Yolanda, and comedians Kirk Fox, Kate Rigg, and Kathleen Madigan. Now, you say you think women would be better.
Yeah, I think so.
Why?
A beautiful woman, I think you can smooth a guy cop. I think at some point you can break them down. And I think a woman... No, it's nothing to do with good or bad. I think a woman, when we're like said to, you know, you're going to get a ticket, you're going to get a ticket.
Women are less corruptible. I mean, literally, there are cities around the world now which are hiring women to become police officers because their police forces are so corrupt.
Estonia?
No, not in Estonia, but in Russia is one of them. That there are cities in Russia where they are now... Look, the bottom line is the U.S. police forces aren't that corrupt that you have to literally say, we have to go... Our situation is so bad, so bad.
Survey in Detroit.
That we have to go find women. And women are better at diffusing violent situations.
Well, Heidi is a former highway patrol officer.
but that doesn't mean her votes go to the women. Take a look.
Hi, Dr. Phil. I'm a retired California Highway Patrol officer, and I have to disagree with Dan Abrams on this one. I learned firsthand that few women have the drive and focus to do the job right. There were a lot of women I just didn't want to work with because they were either too emotional or too small to get the job done. The worst part was when it came time to hit the pavement and wrestle someone into a pair of handcuffs, some of my fellow female officers would just stand by and watch. I actually had to look up and ask for help. I'd be like, hello, get your butt down here and help me out. This isn't an episode of Cops. I'm sorry, Dan, but women aren't always better at everything.
Okay, so Heidi, you would rather partner with a male officer if you were going to partner with somebody?
Well, yes, Dr. Phil, I would say that because, you know, there's no black and white in anything, but when it comes down to really, when you're trusting your life to someone, I would think about, am I literally going to trust my life to them? And honestly, there weren't that many women that I would say, yeah, I'll work graveyards with you. Because that happened to me numerous times where I was literally rolling around, looking up, and she's watching. And I'm thinking, badge, gun, help.
Yeah. You think a guy would jump in there and help out? And
I can say in my personal experience, I was never in a fight where a guy did not just jump in. And that's all agencies, because I worked in the Bay Area, so we worked with police and sheriff and highway patrol. But there were numerous times when the women would sit back, and it was almost like they were watching to see what would happen.
Do you think that women were able to diffuse violent situations better? Because that's one of the things in the book that, and I'm just curious as to from your personal experience.
Absolutely, I would say yes, and I'm glad you brought that up, because the guys used to tease me. They would say, well, how did you get that guy into handcuffs? Or what did you do to get him to jail? Honestly, I'd say anything. I think I'm engaged to like 4 drunks. Really, it's like, you know.
So am I. But not for the same reasons.
Yeah, but they keep sobering up, and then you got to get you another one, right? Yeah. All right, next, do women make better doctors? We're going to talk about that when we come back. We're talking about things that women do better than men, and Dan Abrams says that the female sex also makes better doctors. So we asked one of the best to join us. Now, Lisa Masterson is the co-host of TV's Emmy award-winning daytime show, The Doctors. Take a look.
We're going to give you the ladies' insight, right? The secrets to how to deal with these crazy men. This PMS smoothie is backed up by research. Make sure that you use cucumbers. Put away that tequila.
Jimmy boy.
And get a shot of wheatgrass.
Cheers.
We're going to go set up some tents and try and help the people. Her blood pressure is 173/96. We got to get her to the hospital. We're doing the first OBGYN residency program in Africa. Keep on, good. And when you deliver a baby, it's just a special feeling every time, every place.
I want to applaud you for all that you
do. Well, as we say, Dr. Lisa Masterson is one of the co-hosts of The Doctors, and you do a great job on that show. I know everybody watches. So, who makes better doctors, men or women?
Well, you might be surprised at what I'd have to answer to that, given the fact that I'm tussling with those 3 male doctors every day on the television. But I really think it's about, you know, what's in here and what's in here. I'm all about equality, and I've seen some male doctors who are phenomenal as OBGYNs, and I've seen some, you know, female doctors who are obviously phenomenal, but also who are, you know, colder than an iceberg sometimes too. So it really depends on, you know, how you feel with the patient, how you empathize with them. I think that brings another level, because we're all well trained, you know, here in the U.S. We're all really well trained as OBGYNs. And, you know, once you've passed all that, you know, muster mentally, it's really all about what you bring to the table.
Like, how many babies have you delivered, would you guess?
Well, thousands, because I trained at LA County USC, where they used to do about 12,000 to 15,000 deliveries a year. So lots.
Lots. And women endure pain.
Women endure lots of pain, but I don't think it's so much about childbirth as about those maternal instinct. And that's one thing where you guys aren't going to match us. And that's that motherly love. But I don't think men can bring that to the arena.
Yeah, but I'm talking about the energy here, because you're a doctor with a practice. You're a mother. You're co-host of an Emmy Award-winning television show, and you've written a new book called Paper Dollhouse. And when did you write this?
Well, as women, we multitask, don't we? And that's another thing that we are very, very, very excellent at. As we're rocking the babies and writing books and we do something with our left foot. We do it all. We do it all.
We're out getting hit by lightning. You know how hard that
is? Did you write it at nights? Did you write in the mornings? When did you do this?
Nights, weekends, days, anytime, because basically it's a labor of love. It's an homage to my mother, because my mother was really the strength and the force that got me. A lot of people want to know how I became a doctor and how I, came to do all the things I do, and it's all dedicated to my mother because of that strength. My mother was a champion of equal rights, and it's all about not just women, but I really, really want women to shine, because there's devalued in so many other places. We've been devalued a long time in the U.S., but in so many other countries, and to really have women find their power, to empower them and make them sparkle and shine and know all their strengths, because that is the kind of strength that my mother gave me. Not be afraid to be heard. Absolutely not be afraid to be heard.
Do you think your daughters have had an uphill battle because they're women?
I think it's difficult for them, especially being in Los Angeles. I worry about them. I think in general, women have to kind of work twice as hard to be taken half as seriously, and that is a struggle. But we've come a long way.
Yes, we absolutely have come a long way, and we just have to keep pushing those boundaries.
Yeah, I want to know what all of you at home think about this question: who makes better doctors, men or women? Go to drphil.com right now and take our poll. All right, I want to thank the entire panel for helping out today. Again, Lisa's book is Paper Dollhouse, and Dan's book is Man Down. Now, David's latest CD, DVD, Hitman Returns, is a follow-up to his 2008 Hitman, David Foster and Friends. And I am a fan.
I love you for it.
I know your music, and you can see David Foster and Friends live at Mandalay Bay Events Center in Las Vegas this fall, October 1st and November 25th. Now, are you going to tell me about this?
All women guests.
No.
All women
Sometimes
for free.
you don't tell me when you're doing something.
Any woman comes in for free. No, yes, I'm going to invite you for sure. You came to my show last year, and it was great to have you in the front row. I gave you a lot of...
You made fun of me?
I made fun of you.
You made fun of me.
I made you sing.
Row. You made me sing.
The guy cannot sing a note. Watch this. Sing this note.
I'm not doing it.
Sing this note.
I'm not doing it.
Sing this note. La.
La. I can't do it. Andrea Bocelli.
Good.
You are a hack, because Andrea Bocelli got me to sing a note, right? Remember at the dinner table?
Yeah, I remember.
You remember
yes,
that? At the dinner table, he got me absolutely on tone.
It took him the whole dinner to get you to do that.
Well,
we don't have all that time.
You can start buying tickets to this in May. We'll be right back. Well, I want to thank all of my guests today, including Dan Abrams, David Foster, thank you for being here. Yolanda, thanks for joining us. Dr. Lisa Masterson, thank you so much. Comedians Kirk Fox, Kate Rigg, and Kathleen Madigan. Everyone in the audience is going home with a copy of Dan Abrams' book, Man Down. And you're also getting David Foster's Hitman Returns CD and DVD. And a compelling and thought-provoking read, Dr. Lisa Masterson's new book, Paper Dollhouse. We're going to see you. And thank you to Paget Communications for providing the Paget gadgets used for today's show. Thanks for being here, everybody. Thanks so much. Thanks, guys. Bye-bye.
俗话说，清明折读过蛇。不久前有一位女士，因吃了一根甘蔗，身体多个器官衰竭，生命垂危，险些丧命。 51岁王女士已经吃红心了甘蔗，出现恶心、呕吐、胸痛的症状。送到医院检查都没来得及做，王女士就出现了肺水肿、氧饱和度骤降、呼吸衰竭、生命体征不稳的情况。原来王女士严重中毒了。现在天气渐暖，人们吃水果的热情逐渐高涨了起来。但是在春暖花开的季节，水果并不是特别好，买也不是特别多，尤其是在清明前后。但是有3种水果，不管多便宜，大家都不要吃。小新和王女士有一样的遭遇，到底是什么水果？一起跟着来了解一下吧。这3种水果不能吃。1. 芒果。第1种，在清明前后不可以吃的水果就是芒果了。咱们都知道，这个芒果属于热带水果，它成熟的季节基本是在6到7月份，清明节前后是4月份左右。这个时候的芒果不是当季的时令水果。想要让芒果长久地保持新鲜，肯定是要经过特殊的保存方法的。但是这种特殊的保存方法难免会添加一些添加剂。如果这个时候咱们大量食用芒果，肯定会对我们的身体造成一定的影响。所以喜欢吃芒果的朋友千万不要在清明节前后吃，不妨多等上2个月之后再吃新鲜当季的芒果。2. 梨。清明节前后第2种不可以吃的水果就是这个梨了。梨不属于热带水果，在我们北方成熟的季节基本上都是在秋季。清明节前后吃的梨也都是经过1冬天的保存了。梨子虽然有清热去火的功效，但是经过1冬天的储存，里面的水分基本上都被控干了。而且梨子的表皮非常的薄，稍微磕碰一下，外皮就会出现破损，果肉也会坏掉。像这种梨子买回家基本上都是不能吃的，白白花冤枉钱。还有一个原因，就是我们这种清明节，它是中国的传统节日。这个离同谐音分离的意思，像这样寓意是不太好的。大家在清明节的时候也最好不要吃。3. 甘蔗。第3种在清明节前后不可以吃的水果就是甘蔗了。有这样一句老话，叫做清明蔗毒过蛇，意思就是清明前后的甘蔗毒性非常强，甚至强过于毒蛇。虽然有一点夸张的成分，但是也不无道理。清明节前后，也就是4月份左右，气温已经明显回升，而甘蔗在气温明显回升之后，极其容易变质腐坏。变了质的甘蔗会产生一种化学物，叫做硝基丙酸。我们之前提到的毒性都是来自于这种物质，并且这种毒物在摄入不到0.5克就可能让人中毒。所以说，为了我们的身体健康，这个甘蔗不管有多好吃，大家也一定要控制住自己，毕竟是为了身体健康着想，身体才是最重要的。其实清明更适合吃一些略带苦味的降火蔬菜，志恒在这里给大家推荐几款即使你再忙也别错过的蔬菜，营养丰富，味道鲜美，好吃又好做，满满都是春天的味道。这些蔬菜一定要多吃。1. 野蒜。野蒜有些地方叫野葱、野小蒜等，顾名思义，这种蒜不是人工种植的，生长在野外山坡或者沟壑草丛中， 香气十分浓郁，可以被称之为春天里的第一香。比人工种植的家蒜那可要鲜香得多了。野蒜的吃法有很多，比如凉拌野蒜、野蒜炒腊肉、野蒜干锅虾、野蒜煎饼、野蒜炒鸡蛋等，都是春天难得的美味佳肴，野味十足。我们在家可以做一道好吃的野蒜炒腊肉，香上加香，满满的农家风味。2. 豌豆苗。豌豆苗顾名思义，就是豌豆上的苗苗，嫩茎叶又叫豌豆尖和龙须菜，是近几年非常流行的一种蔬菜。只可惜它不是野生的，都是人工种植的。看来不花钱还是别想吃了。由于豌豆苗可不是一般的蔬菜，花点钱也是值得的。豌豆苗可谓是色鲜味俱全，味道清香，口感滑嫩，颜色翠绿，营养价值高，其中含有氨基酸，是一般的蔬菜3倍有余，是大部分南方人的最爱。食用方法简单，灵活多样，不管是清炒、做汤，还是作为火锅配菜，豌豆苗都不失为人们餐桌上的一道上等蔬菜。3. 槐树花。槐花也叫洋槐花，也就是槐树所开的花。槐花开起来非常漂亮，是春天一道亮丽的风景。现在的季节正是槐花遍地开放的时候。槐花是春天里难得的一道美味，虽然略有苦味，但是烹饪之后，吃起来的口感却是清香甘甜，春意浓浓。槐花可以做成很多食物，比如槐花粥、槐花茶饮、槐花饺子馅、包子馅、槐花炒鸡蛋、槐花煎饼等。4. 玫瑰花。现在正是玫瑰花开放的季节，说起玫瑰花，可以说是人见人爱，没有人不喜欢的。特别是正处于恋爱中的青年男女，因为玫瑰一直以来都是美丽和爱情的象征。但别忘了，玫瑰不仅外表美丽，还是一种很好的食物，富含维他命 C， 常常用来泡茶喝，也可以做成各种各样的果冻和面包。这些美食颜值高，味道美，具有玫瑰花芬芳浓郁的香气和干中带有清苦的味道。5. 艾叶。艾叶可以说是清明节非常珍贵的野菜，又叫艾菜、毛肖等。它是清明节前后野外十分常见的野菜，也是最适合清明节前后食用。艾菜的营养价值极高，富含艾叶油、膳食纤维和多种微量元素，具有特殊的辛香味，是非常值得食用的一种野菜，也是南方人的一种传统食品。其食用方法非常简单，常常用来熬粥、熬汤、煎鸡蛋和做艾草粑粑，味道都十分鲜美，还有增加食欲的效果。清明除了吃，自然也少不了祭祖这项传统习俗。那你知道祭祖应该带什么水果吗？祭祖能带的水果：1. 苹果。苹果不仅长得圆圆胖胖，味道也又香又甜，一直受到男女老少们的喜爱。最重要的是，苹果有平安的寓意。2. 橘子。其实以前橘子一直都没引起重视，不知道从什么时候开始，橘子就成了吉利果。无论是过年接神敬神，还是平时的祭祀，都会把橘子放在香案上。不信你去看看影视剧里的祭祀镜头，